was slow. It's starting to speed up again. And people that are symptomatic can definitely get a test. And we're hoping to have some kind of procedure down by the time school starts that teachers and students will be able to go somewhere for a quick test.
There are some people in our community who feel as though perhaps you alone are making these recommendations, and that there are other organizations in the medical field that are making recommendations that contradict either you or the state. Are there other groups and individuals that you consult with to help you make your recommendations? And how would you respond to somebody who says, but this organization says something different?
Yeah, it's kind of funny. And a lot of this kind of goes back to the 3-foot versus 6-foot situation that I've been dealing with for a long time. Our recommendations here in Bucks County, I want to clarify this, hopefully for one last time, is that we suggest 6 feet as being the optimal distance to separate the children. However, based on a lot of good data and organizations around the world, that a minimum of 3 feet. I was the only person to put a minimum of 3 feet into my guidance. There's no other organization, at least initially, that put the 3 feet in there. The Association of Academy of Pediatrics has now put in a 3-foot minimum. The state of Massachusetts, the state of Virginia has put in the 3-foot minimum. And again, it's not saying aim for 3 feet. And we've never said that here in Bucks County either. We've said the 3 foot is the bare minimum because there is data to back that up. The WHO has been saying that for years. Up until recently, on the CDC website, they still talk about droplets 3 feet. The Lancet had a huge study, and this came out in early June, right when I was doing my guidance, that showed that 1 meter or 3 feet has a huge reduction in the spread of droplets, because this is a droplet spread disease. So, the idea that my guidance is completely contradictory is actually really not true when it comes, especially to that one particular issue, which is what I've gotten a lot of comments on. The 6 foot is the optimal goal, but 3 feet has a lot of scientific backup behind it. I'm not the only one saying it. AAP is it's the preeminent pediatric organization in the United States, if not the world. And they said the same thing, right? 3 feet is the bare minimum that you should have distance between children with a mask on. And I went through a lot of things. I didn't make those guidance up off the top of my head. I looked through all the research and the data that was there. I looked through the countries. There's a lot of countries in Europe and around the world. There's very few countries in the whole world that actually use 6 feet. As a matter of fact, there's only a couple of countries that do. Most countries in the world utilize the 1 meter / 3 feet guidance. And most of those countries have this under better control than we do. So to say that 6 feet is the be all end all, I would have to disagree that it has to be 6 feet to get it under control. Because again, a lot of countries have gotten under control. Now they've worn masks, they've done lots of different things. So, and I'm not pushing 3 feet. I'm just saying that that's the bare floor minimum where there's evidence that it works. So if we can get to 6 feet, obviously that's what we're recommending. But I want to just I'm going into that because
and the Bucks County guidance in terms of students and staff being able to remove their face covering if they can guarantee at least a 6-foot distance? Again, I want to clarify that we're talking about in a classroom when people are seated and at least a 6-foot distance. There are many who would say that is not wise. Do you feel as though that is an appropriate piece in a health and safety plan?
Yeah, and I actually clarified that exact point with the State Department of Health. And I said, if you have children seated in a standing stationary position for a classroom period, and they are a minimum of 6 feet apart, the state very clearly said, yes, those students can take those masks off, while they're in that 6 feet of distancing. Obviously, if they get up, if a teacher walks near them, if something happens, they should put their mask back on if that 6 feet is broken. But yes, it is appropriate, and it is actually, very clearly written in the state DOH and PDE guidelines that you can remove your face covering at 6 feet. I mentioned earlier that there could be a time where we would modify that. If there was a positive case in the room, we may have the children at that point wear a mask at all times because in that modified quarantine situation. But yes, it is clearly appropriate, and I double-checked that with the state that it is okay to do.
Only 8 more, Dr. Damsker. You're doing great.
Sure.
Why are temperature checks not required for students and staff when we often read about them for businesses?
Sure. Well, number one, what I can tell you is, and we have a lot of data here. I told you we have 6,800 cases, plus a lot more people that we've spoken to that never got tested, but we know they had COVID. A lot of people never develop fevers. The majority of patients with COVID either don't develop a fever at all during their entire illness, or they develop a fever after they've already been symptomatic with 3 or 4 other symptoms first. So someone has the sore throat and the headache and the loss of taste and smell, and then they develop a fever a couple of days later. Now, that's not to say that no one has only developed a fever, because obviously that's been the case, but the vast majority of people, you'd be missing them by doing temperature checks at the schools. So not only would you be missing the students, giving a false sense of security, but you're also talking about, clogging up. If you have 800 kids in a school and you have to have them all temperature checked, you're talking about now grouping them together, smushing together, basically breaking the 6-foot social distancing without having kids, down the block. And it's certainly not recommended either. And the CDC doesn't recommend it anymore either. I'm not sure if they even ever did, but we certainly have never recommended that here in Bucks County for schools.
Inconsistency we often hear about is that public spaces are limited to a certain number. And that number has changed over the last couple of months, but lots of spaces are limited to a certain number, but classrooms and schools are not. Can you explain why?
Yeah, I think that, there are obviously different rules for different essential services. Schools are considered by the governor to be an essential service. And he has made alterations to his rules for specific things like classrooms, knowing that there may be a situation where you could get more than 25 kids in a classroom safely. The occupancy rate of 25% is not in play either. But certainly in schools, things like assemblies, those will not be allowed. Those are more than 25. It's not everything in schools. It's specifically classrooms and situations like that. They don't want to have large meetings in schools. They don't want to have assemblies. But the classrooms specifically, because I know that the governor wants schools to be able to open in person if possible. He said this publicly multiple times. And I think there's a safe way to have, more than 25 kids if necessary in a classroom. That doesn't apply, but he's made it clear that, and I've clarified this with the state health department as well, that classrooms are not required to be, in those categories. And I think a lot of it has to do with, again, essential services are always treated a little bit differently in certain respects, and this is one of them.
You mentioned obviously the guidance and the goal is 6 feet wherever possible. And that's obviously true in Pennridge, that all of our classrooms will be set up based on the exact number of students needed. And so some classrooms might have 8 feet, but there will be classrooms that do not have 6 feet, that might be at 4.5 or 5 feet, which are some of the averages as we put classrooms together. So why is it okay for Pennridge to set up a classroom where a desk is less than 6 feet apart from the one next to it? And is that safe if everyone is wearing a face covering?
Yeah, and that's exactly right. The fact is, you're more than 3 feet, so we know there's a reduction of spread right there, and then everyone will be wearing a mask. So the governor's universal masking order has made a lot of this easier to do, because before you're 5 feet apart, you said, well, they're not wearing masks; they're within 6 feet. Now everybody's wearing a mask. And look, if masks work or they don't, and we keep getting more and more evidence that people want, the federal government keeps saying everyone's got to wear a mask. They put mandatory restrictions on people wearing masks. So clearly, there's the thought out there is that they work. So if you're 5 feet apart and you're wearing a mask, 6 feet isn't. There's no magical number for 6 feet, right? The droplets, when someone coughs or sneezes or talks, the largest droplets, which is what are most infectious, they go out and they kind of fall. And a large portion of them drop at 3 feet. And of course, as you go a little further out, a few more drop out, a few more drop out. So 6 feet's better than 3, 9 feet's better than 6, 15 feet's better than 9. And I say this before, I'm not going to give COVID to Dr. Bolton right now because we're really far away from each other. And I think it's important that as long as you're within 6 feet and you're wearing a mask, you're really reducing the risk in multiple ways. Not just the distance, you're over 3 feet, but it's also the masking of both the source patient potentially and the person who's trying to protect themselves from that source patient.
I know that you've done many of these forums, and I appreciate you, staying out late again tonight in your office to do this with us. One of the things that you mentioned that is not in our plan is the modified quarantine, so that's something that we'll have to consider. Are there other recommendations that you would suggest for Pennridge that are not currently in our health and safety plan that would help keep our students and our staff more safe?
Yeah, I think you guys have done a really, really good job, to be honest. I tried to put as many of those things in the template that I sent out that would be, the minimums, as we'd like to talk about. And you guys have taken that, and gone even further in a lot of ways. I think a lot of it's common sense. I think we're really relying on, and you can't put this in your health and safety plan because it's hard to make it, but the parents, everyone's on this call tonight. I want to just emphasize how important it is to keep kids home if they're sick, to get them tested. There is some guidance that is out there that the state put out recently, and this is on their website. So I'm certainly not saying anything that's private. But if a student has no risk of COVID exposure, and they have a sore throat, and they go home and they feel better the next morning. If you have no sore throat and no fever for 24 hours, that child can come back to school, assuming they had no exposure to COVID that we know about. So, there's things in there that have come out, certainly that came out pretty recently when the governor put out that new guidance a couple of weeks ago. So there's definitely things that, you can always tweak it. And I think your health and safety plan is really, really good. And I promise you, if I see things, that need to be added or tweaked, I'll talk to Dr. Bolton right away, and and you guys and the school board can look at it with him. But overall, I'm very pleased with the health and safety plan as it's written, and I think that you guys worked hard on it, and I think you guys did a really good job.
There were multiple community members who expressed lots of concern for school nurses, because obviously school nurses are the ones who see all of the students who are sick, especially in this time with COVID and the possibility of that. What types of advice and recommendations would you have for school nurses?
Yeah, and I've had some meetings with the head school nurses at all of the school districts, and we've gone over. Look, I think the school nurses are a huge part of this. They're one of the most important parts of this whole process about going back to school. They have to be. I think that they're going to be leaders in the situation. They have to keep people calm. They're the medical representative, in our schools, and it's really important that we give them whatever support that they need. I think that obviously they have to have a full set of PPE available to them at all times, meaning, face shield, mask, potentially an N95 mask if they have to nebulize someone or provide some kind of thing that, a procedure that aerosolizes, and have them, have as much, supplies as they need to get the job done. I think the school nurses, you guys talked about in your plan, you have an isolation room. It's really important. And I think the school nurses, it's really important that parents communicate with school nurses on things like allergy, asthma, things that could look like COVID, but on a regular basis, little Jimmy, every spring, every fall, little Jimmy has a stuffy nose. And when he takes his Claritin, it gets better. Or a little Bobby has asthma and he gets a little short of breath sometimes. And when he takes his inhaler, it gets better. I think it's really important the school nurses to maintain good contact with the parents of those children in the schools that have medical conditions. So when the teacher sees something wrong and they send it down to the school nurse can say, "Oh, it's okay. This is just asthma or allergies. I'll give them some clarity to see how they respond." Because we don't want to send everybody home who has a disease that's going to manifest itself every day, or if someone has chronic migraine headaches. And there's all kinds of situations. And our school nurses, look, there's no question about it. They're going to be under a lot of pressure. The health department, we have promised, will be available for them at all times for questions. And as long as they have proper PPE available to them, and they have as much support from the school districts, and I know that they do, I think they can do a terrific job, and keep everyone safe. They are the medical representative in that school at all times, right? So I think it's, whatever we can do to support them, and the health department, we've met with them multiple times with the head school nurse from each district, and we feel like they can do this safely and do it well.
What about classroom teachers? I mean, obviously lots of things we talked about have to do with the classroom here. Are there other recommendations you would have for classroom teachers that we have not mentioned tonight?
Yeah, well, obviously, number one, we talked about the teachers staying 6 feet away from the students when possible. If they're not able to stay 6 feet away, I would encourage especially teachers that if they feel they're at higher risk of COVID, there's no reason they can't wear a face shield and a mask. They can approach it, because they're going to have to look, especially with the younger children, no question about it. They're going to have to potentially look over a kid's shoulder, help them with the handwriting, or help them with reading, help them with a math problem. It's very difficult to totally teach, obviously, from standing 6 feet away. So if a teacher is able to wear a mask and a face shield, if they feel that's necessary, at least a mask for sure, that's what nurses are wearing in hospitals that aren't on COVID units, of course, and it's kept our healthcare providers, pretty safe. If a teacher decides they want to wear an N95 mask at all times, that's up to them as well. But I do believe that that's what they have to do. Is PPE is sort of the answer here, because you can't always distance. It's almost impossible for a teacher to always be 6 feet away. I'm assuming in high school it's probably a little bit easier. It's some middle school classes, but when the kids are small, sometimes there's little things you have to do. And if those kids are wearing masks and the teacher's wearing a mask, it's pretty safe. And I think that the teachers have to keep all that in mind. I know it's tough. There's no question about it. Look, I know the teachers have been. Some of them are very worried about coming back. I think everyone on this call tonight, sympathizes with that. There's no question about it, right? It's especially if the teachers haven't been, in work status, at least in person work status for many, many months. And I want them to realize that what they're walking into on the first day of school right now is totally different than what the last day of school was on March 12th, or whatever that day was, Thursday, March 12th, I think it was. And, that nobody was wearing masks. Nobody was washing their hands. Nobody was paying attention to pretty much anything with regards to hygiene. I'm not saying that the custodial staff wasn't doing their job, but I'm saying in reality, it was sort of the Wild West of sanitation. Now we're going back to school. Everyone's completely paying attention to what they're doing. They're all washing their hands. They're all wearing masks. The teachers are paying attention to what they touch. The surfaces around the school are being wiped down. There's no more water fountains. I guess you have to use a water bottle. There's so many things that are totally different in our schools that weren't being done back in March. So I want teachers to realize they're not just walking back into the same situation that they were coming back to 6 months ago, 6 months ago. So I want them to think about that too. I think hopefully that'll be helpful if they really go back and think, wow, this is going to be different.
Last two from me. One has to do with long-term effects. Obviously, this is a relatively new conversation for all of us and a new virus, at least for us. And so what concern do you have about the unknown long-term effects simply because COVID hasn't been around very long?
Sure. And it's interesting, we've had a few people, when I say long-term, one of the most common things we've seen are things like loss of taste and smell. We've had people who have lost their taste and smell for a few weeks, and clearly they're not infectious anymore, but because the virus can attack the olfactory bulb and the nervous system, it can make people lose their sense. It affects the nerve, so the nerve stays, aggravated for a few weeks. We've had people that have had, headaches. They've had other things that go on further than their actual infectious period, which is about 10 days at the most. So, and obviously there's people that have gotten really, really sick and they've been in the hospital and they've had other issues. But it's still a coronavirus, in long and short of it. Has it made people very sick? Of course it has. Has it given people symptoms for a couple of months? Yes, it has. However, we don't believe, there's nothing to make anyone believe that this is going to cause lifetime issues. Now, of course, if someone is ventilated for a month and their lungs get damaged, from ventilation and other things, I mean, those are things that could happen, with any disease where you're ventilated. People have lifelong illness from flu if their lungs are damaged in a certain situation. But I don't believe at this point there's enough data to indicate that there's going to be lifelong, trauma from certainly for the vast majority of people, given that most people have, a runny nose or a headache, and it goes away in a couple of days. And even the people and I've spoken to multiple people that have been hospitalized. I've spoken to people that have been ventilated, and they're doing really, really well. So I can't say, will anyone ever have a long-term effect? Because you can't say that about any disease. People have had long-term effects from the flu, from measles, from mumps. So any virus that gets someone seriously ill can cause long-term effects. And I don't believe coronavirus will be any more severe than the other viruses that we have going around on a long-term basis. We haven't had any data to show that anyway.
What about classroom ventilation? What kind of recommendations would you make? And especially the concern that a ceiling fan or a floor box fan might actually be moving the virus around and make it more likely for someone across the room to catch it.
Yeah, so most importantly, and I believe most schools are able to do this, even if you don't have an air conditioning system, if you have any kind of circulation, you have a fan, you have a heating system, the most important thing you want to do is shut off the recirculation dampers. And you want to bring as much fresh outdoor air as possible. That's the number one most important recommendation, is you bring. Now the problem with that is, of course, it produces more of a stress on the equipment, because with any air conditioner or any system, you're bringing in hotter air in the summer to try to cool it down, but it's safer. So you want to encourage whatever system you have fan wise, leave the fan on all the time, and bring in outside air as much as possible. That's number one. And the other thing is with fans. What you want to do with fans is, especially in a room that has windows and a door, you want to have cross ventilation that goes from window to door, so it doesn't linger. And fans, if set up appropriately, what you can do is you create a positive pressure room. In healthcare, we have things called negative pressure. So if someone has a disease in a little exam room, they have fans that bring air in to that room. So if someone has tuberculosis or measles, it doesn't let the air escape from the room, it brings it in. In this situation, you want to have sort of a positive pressure, which means you want the air to go out of that room to move the air better. So you could put a fan facing the door and have the air blow out of the door and create a current that exchanges the air outside of the room on a more frequent basis. So you wouldn't have the fan facing the teacher, you have the fan facing out, and that will draw air out of the room as it creates a positive pressure. So that's another thing that you can do in a situation. And that just makes, so even if you have a ceiling fan going at the same time, all that air, it creates a good current that gets it out of the room. And what you don't want to have is sort of stationary air that's not moving at all. That's what you want to avoid.
And obviously, many classrooms have windows, but they don't all. And so if a classroom doesn't have windows, your suggestion would still be that pushing it out into the hallway and circulating it out of the room that way.
Exactly. Yeah, you want to have You want to have the recirculate. You want to have the outdoor air coming in through the vents, and you want to push the air out of the room as much as possible, and that creates good circulation in the room. Yes.
And just for the benefit of anyone who may not have been on one of our previous calls, the district has replaced all filters in every system, as well as increased as much as possible the air circulation. It's not the same number in every building simply because air conditioned units are different than non-air conditioned units in terms of what you can do. But we have made those adjustments to our system to make sure they are as efficient as possible.
Can handle these bugs.
That outside air. So, Dr. Damsker, I thank you. We asked you for an hour and you gave us more than that, so I do appreciate you sticking with us.
I can handle these bugs.
I'm going to just remind folks in terms of if there are additional questions, a couple places to go. One is obviously the FAQ document that is still on our website and has been sent out and updated. So often that's a good first piece. There is information there from the Department of Health as well as from Pennridge. So some of the health and safety pieces. Also want to remind you, your building principals are a wonderful resource if it's a question specific to your child. We do have the fall 2020 planning at pennridge.org, which is a monitored account. We originally had said that we wouldn't be able to respond, but we have 3 people monitoring that and have been able to respond to every email that's been sent there. So if you have questions for the district or Dr. Damsker that are not child specific, that's a good place. You can also email me directly. My email, beginning of my email at least, is on this box for you to send to me. So Dr. Damsker, I thank you. I know we'll continue to work with you, and as things change and we need to make adjustments, you'll be a key part to that. So thank you for joining us tonight, and we'll be in contact if we have any follow-up questions.
Thank you. I appreciate it.
Thank
Good night.
you, Dr. Damsker.
Thank you.
I have a,
Oh,
I
sorry.
just, I have a Pennridge specific question about the shields that the county is going to provide. Are those shields going to stay at school? What's the idea with those? Would they stay at school, go home, so that they could be cleaned? What's the plan?
Our expectation, Ms. Cohen, is that as long as it's possible for the student, that they would transport those back and forth. We think that those are valuable resources for the families, for students, if that's the way that they choose to use that, either in addition to a mask or as their face covering, as well as some of those cleaning protocols that we're talking about. Obviously, there may be individual instances where that's not possible, but that's our initial plan to start the school year.
Can I ask one question about the face shields while you're on it?
Ms. Rowland, I will wait till public comment at the end,
Okay.
and then I'm sure we'll have lots of questions that come from that. Thank you for waiting.
Are there any other questions or comments from board members before we move on? Okay. Next on the agenda is the review of contracts for approval. Mr. Dahlbert?
Thank you, Mrs. Bennett Clemens. And we have a few more items to get through here for finance and facilities so that we can get those items to the board and this month for a vote. So if you could bear with me for just a few minutes, I'll go as fast as I can. And if you have any questions, please feel free to stop me. But under contracts, we have a number here for this month. First is the wood services for an extended school year and a full year one-on-one aid. These are services at a cost of $58,305. Item B is Joseph Warner. Dr. Warner reviews our IEPs each year. His cost is $175 per hour, and that is the same cost as the previous year. C is our Bucks County Intermediate Unit Truancy Services Agreement. Again, this is a service that we use on a cost per fee schedule, which is attached, and we only use these services as needed. We do our own work in that area, but sometimes if we need additional services, the IU services are there for us to tap into. D, E, and F are New Hope Academy. These are all 3 are educational services for students. The cost is $38,400 for each student. And these are students that are placed on NORIPs. G is the Valley Forge Educational Services. Again, this is another extended school year program for a student. And the cost is $6,544. H is Vector Solutions at a cost of $1,447. Vector Solutions is our Safe Schools training modules that we use for teachers and staff for training on various things. I is Foundations Behavioral Health. That is a contract that we have each year for behavioral health services for students who need those services. J, Keystone Freedom Academy. This is another special education services agreement for a student, and the cost is $235 per day. K is Dr. Christopher Warner. Dr. Warner provides our student dental exams, and the cost is $35 per hour. And again, this is no change from the previous year. L is teach for.
Mr. Dobbit, one
Sure.
question, or not question. I would have to abstain from the vote for number K because of my relationship with the COVID-19 financing program.
Okay.
Okay.
All right. Thank you.
You're welcome.
I'm sorry. Jump back here.
Mr. Cormack, when that comes up for the vote at the meeting, just ask for that to be voted on separately, and then make sure that you restate your conflict of interest.
Thank you. Okay, L is Teach for Equity. This is an educational consultant agreement to provide 3 training sessions during the 2020 year. The cost is $4,650. M PBIS Rewards Suite. This is a positive behavioral interventions program that is being used for the first time at South Middle School next year. The cost is $1,766. N is our annual Jostens yearbook agreement for the Central Middle School. The yearbooks are paid for by the parents and students. And then O, the last contract, is Apex Learning. This is an amendment to the amendment number 4 to the agreement for online courses. The original contract was put in place back in 2016, and then each year the amendment or contract is updated with an amendment. The costs are unchanged. Again, these are our online courses that are used in the distance learning program. So that's all the contracts. Is it okay? Keep going.
Go right ahead. Yep.
Okay. The next item is the Insight Financial Services lease resolution. Solicitor Miller provided the resolution for us to put on the board agenda. This is the last step to basically putting the lease in place for this year's incoming freshmen's laptops, their laptops, and a number of teachers' replacement laptops we have on the lease this year. And like I said, the board originally approved that lease in on May 11th, but with all the final documentation now in place, we follow up with the final resolution that Solicitor Miller has provided us. So the next item is the proposed nutritional services employees compensation and benefit plan. That document was updated and provided to you, to the board members for your review. All the changes are highlighted in red in that document. If you have any questions about any of those changes, please let us know. But I know that Dr. Bolton had provided you some information previously on this this contract or the agreement update. So if it's okay with you, I won't go through and read all those. I'll just let the board get back to us if you have any questions, and I'll assume at this point that you don't, unless you stop me. So
Mr. Daubert, will you simply highlight the starting rate and that change, as well as the annual raises in the agreement, please?
Yes, the starting rate will be raised from the current $10 to $11 to bring the district's employees more in line with the averages in the county for the starting rate. We'll also have raised the sub rate to $11 to try to attract more substitutes to work in that department. Overall, the raises were for other employees were 2%. Yeah, the other groups were 2%, and then there were a few other language changes that Mrs. Geritana and the group worked out. Some uniform issues and some we took out some X-ray and physical exam language. Just some small changes just to bring the agreement more in line with current. The total cost of the changes is just over $8,000, $8,076 for the contract changes for the year. And again, this is a 2-year agreement. Okay. The next item we have on the agenda is testing for lead in drinking water. This is a annual requirement now by the state that the district has a conversation or a talk that about what we have done in this area. So Kelly is standing by to give you an update on our lead testing. So Mr. Harper, if you're still there, would you jump in?
I am, thank you. So good evening, everyone. And as Sean said, the Act 39 from 2018 requires all school districts in Pennsylvania to test drinking water for lead. Last year, if you recall, we had our environmental consultant lead us through the process with the intent that we would take it over this year. And I can tell you we saved 40% in cost in doing it ourselves. And the testing that we did at each school, we did 5 samples, had those samples sent out in June. With all the COVID testing, it took a lot longer to get results back. And the results we did get back showed 4 different drinking water sources had a high elevated amount of lead. So what we did as the remediation process is we replaced those fixtures and we retested those samples again. Those samples are currently out at EMSL labs. We're waiting for the results. Typically, when you replace the fixtures, be it the water fountain, the bubbler, or the faucet, that typically remediates that. So the test I have back, or when they come back, I expect them to be below the 15 parts per billion threshold. And if that's the case, we'll return things to normal. Right now, they're isolated so that they can't be used for drinking sources. And being that we did have these higher elevated numbers, we're required to report that to PDE, what we did, what we found, and a new report numbers. So hopefully at the next meeting, I'll have those results to share, and looking for positive news.
Mr. Harper, can I ask a question?
Okay.
Yes.
Those 4 sources where you found elevated levels of lead, were any of those the same as the previous year, or were these different sources that popped up this year?
Right, so good question. So what we did is we used maps of the floor plans of the building, and the goal is to do rounds of the building. So it's kind of cost prohibitive to test every drinking source. If you think about an elementary school, every classroom has a bubbler or a drinking fountain. We would be upwards of probably $20,000 to test all those. So what we talked about in a facilities committee meeting probably a year or more ago, that we were going to do this in a phased approach, 5 sample locations per building every year until we get them all done. And normally you don't get a source show a higher elevated level from a previous year. Does that answer your question?
Thank you. Thank you. I just want to clarify that for those on the line so that we have a clear understanding of the strategy. So thank you.
Are there any other, before we move on to the next agenda item, we kind of just went through a lot. I know most of them are contracts that are up for renewal that we've all seen a bunch of times, but are there any other board members who have questions on any of the things we went over yet? No? Okay. Then we're down to our last item, obsolete items.
Yes, obsolete items. We have at Siler Elementary some Reading Street books that will do public surplus, and some furniture that's no longer needed. We'll do that public surplus. All the items that go to obsolete the buildings have already spoken to the other buildings to see if anyone else needs these items, and no one has claimed them. So at that point, then we obsolete them, and we either, depending on their shape, we will either try to sell them on public surplus, or if they're just too damaged, we will dispose of them or recycle them, depending on what it is. But I just wanted to remind you that we try to move the stuff around the district the best we can first before it comes to you. At Guth Elementary, we have an old printer that's no longer used. It's going to go to public surplus. At Central Middle, we have old wrestling mats that are no longer viable to use for the wrestling program, and we're going to throw them away. They're in such bad shape. At the transportation department, we have some various old office furniture there that we had replaced in last year's budget. So we're going to now get rid of that old stuff that was replaced. At the maintenance department, we have a tractor. I know it's no longer being used. It is very old, and we're going to try to sell that on public surplus. And then we have a mower, a deck, and a power broom that's no longer usable or used. So that will go to public surplus. And then in the technology department, we have 3 months worth of the normal recycling, and then one list of monitors to go to recycling. So that's it for the obsoletes this month.
Thank you, Mr. Dahlberg. The next Finance Committee meeting is scheduled for September 14th, 2020, and we are back to public comment. Again, it's limited to 3 minutes. And if anyone has any public comment. Does anyone have any public comment?
Yes, I just have a question. Well, my question about the face shields that Mrs. Cullen asked about, what they would do with them if they left them at school or took them home. And I was just wondering, would there be something in place for the kids, like before they leave their classroom, or like could they have something to wipe them down before they bring them home? You know, I think if they are going to bring them home, then, you know, that might be something that we, you know, like in my ER, we put our things in a paper bag, our masks, our goggles, our N95s, things like that. We all have our own assigned paper bags that we put them in when we don them off. So I was just wondering, you know, if that's something that we can look into if we are going to send the shields home, if they have like a paper bag with their name on them, you know what I mean, or something, so that we're not bringing all that home. You know, we don't know what's going to be in every classroom, but, you know, just so my first grader's not bringing the shield home to me.
Thank you. And I'll again address all of the questions and comments at the end. Are there other questions and comments?
I have a comment. You can hear me now?
Yes.
I'm Nicole Ray, Quakertown resident, but Pennridge school teacher, and I have a comment I'd like to read. As a dedicated Pennridge teacher for 21 years, each fall I look forward to being in my classroom and interacting with my students in a hands-on collaborative way. Unfortunately, due to the global pandemic, returning to that type of instruction this year is not possible. I made the best of online learning in the spring, continuing to deliver content while navigating uncharted waters. It was one of my most challenging endeavors, and like my colleagues, I persevered to provide my students with a core curriculum. Although I longed to be back in the classroom with them, I knew it was simply not safe. I knew that providing instruction through the distance learning model was the right thing to do to keep everyone safe. Now, 5 months later, here we are, still in the thick of this unresolved pandemic, which as of last night was 118,852 confirmed cases in just Pennsylvania alone, some of which sadly were children. And as much as I wish I could be back in my classroom with my students, I feel as if it is still not safe. With Bucks County being the top 5 counties in Pennsylvania with the highest number of cases, I believe the district should be taking every precaution to protect its students, staff, and community. And it's very disappointing that Pennridge does not seem to be doing so. If the district chooses to follow the basic minimum guidelines as set forth in the current health and safety plan, we risk community spread as well. Being in the classroom during this pandemic will not only be a major health concern, but will require a whole new way of teaching, learning, and interacting. In an attempt to protect our kids and those who care for them from this deadly virus, many constraints, protocols, and social limitations will be implemented and will ultimately change the learning environment of our classrooms. Although distant learning presented daily challenges, I felt overcoming those challenges was imperative in order to protect our Pennridge community. At the elementary level, as teachers and families adjusted to this distance learning, it improved and it became more effective. The teaching staff became more adept in collaborating and sharing and offering guidance to our families. Most students received individual feedback daily and were offered support when they struggled. Although not ideal, this model was an effective way to keep our children's family and staff members safe and healthy. And I think we all agree that Pennridge schools should not be places where anyone is potentially exposed or affected. The likelihood of COVID being spread and infecting someone in the school setting is a very real and valid concern. And there are many situations in which the possibilities of being exposed to dangerous droplets can occur, especially at the elementary level, where young children do not always understand the hazards that this disease presents. As much as we all want to get back to normal, that's not going to happen in a pandemic. That's not normal. Our district must put protecting lives first. And sending innocent people into our schools to be exposed to others where teaching, learning, and socializing will not be as it was is not worth the hospitalizations, the long-term health effects, or even the loss of one life. The Pennridge School Board must do the morally and ethically right thing. Thank you.
Thank you. Thank you. Are there other public comments?
Can I make a comment, please? Oh, sorry.
Go ahead. I can't really see who all's speaking because it's all, so just one of you start talking. Sorry.
Hi, this is Andrea Tambori. I have 2 students in high school this year. I'm a long-term care pharmacist. I have been working throughout this entire pandemic. My patients are pediatric patients and nursing home patients. Our pharmacy has seen multiple pharmacist layoffs. My friend is the pharmacy manager at Einstein Montgomery and has had to furlough pharmacists because they're not seeing the patients and at the levels of severity that are being portrayed on the news and in the media. And I'm glad to see that Pennridge is enlisting facts and science. I would also like to say that I am considered an essential worker. My entire life, I have been told that teachers are essential workers. I go to Giant and we get takeout, and high school students are working in these places. Children are pretty much safe from this virus. And I think it's time to get back to school. The kids want to go back to school. The science supports going back to school. I see it personally and professionally. And, you know, I signed up. This is what I signed up for. And this is also, I feel, what the teachers signed up for. I go to work. I do what I'm supposed to do. Seems like the district, under the guidance of Dr. Damsker, is taking all necessary precautions. And I think it's time to get back to school, and I hope that Pennridge will move forward in that direction. And you know, I understand if there are teachers who are elderly or have are compromised in their health. I have an immunocompromised daughter who is going back to college. We have to live, and the science is on the side of going back to school, and that's what I hope Pennridge will pursue. And I'd just like to say thank you.
Sorry, I didn't realize I was muted. Thank you. And I'm sorry, can you please state your municipality?
I'm at the Grass Central and the high schooler, and I'm in Hilltown.
Thank you. And there were 2 of you trying to speak at once, but I couldn't see both of you. Does the other
It's
person?
something I'd like to, yes, I'd like to speak, please. Can you hear me?
Yes.
Okay. Hi, my name is Alexis Shell. I'm in Hilltown Township. I have 2 children at Central Middle. First, I think that if Pennridge is serious about trying to open safely, they need to adopt a consistent mask policy. Face shields alone are not effective. In regards to social distancing, most experts recommend 6 feet or more. If our schools cannot meet the standard 6-foot policy, having a consistent mask policy is even more important. Face shields are primarily used for eye protection. The CDC on their website does not currently recommend the use of face shields as a substitute for masks. Secondly, I was very concerned to learn that a member of this board is a member of and contributes to a Facebook group called Pennsylvanians for Maskless Education. Not only does this board member not believe in wearing masks, they also erroneously think you cannot spread COVID unless you show symptoms. More than 97,000 kids tested positive for COVID in the last 2 weeks of July. We know children don't get as sick as adults, but they can spread it to other vulnerable populations. Our COVID case numbers are pretty low right now, in large part due to our early masking policy back in April. If we really want to return to school, shouldn't we do it as safely as possible? And I'd also like to respond to someone that spoke earlier that said that kids cannot give it to adults. According to right now, Joelle Simpson, who's the interim chief of ER medicine at Children's Hospital in Washington, D.C., so that's someone who I'm going to trust. She was asked, are they susceptible to catching the virus? Absolutely. And then she was also asked, are they able to transmit the virus? And she answered, absolutely. So unless we listen to the actual scientists, not the conspiracy theorists, we're going to be in a lot of trouble. And that's basically what I have to say. Thank you.
Thank you.
Mrs. Miller, please. Thank you.
Thank you. Are there other public comments?
I would like to comment.
Please state your name and municipality.
Yes, my name's Jen Camarada, and I live in Sellersville Elementary.
Thank you, Mrs. Miller. Sorry, you can continue.
I am a special education teacher at Pennridge High School, and my daughter is scheduled to attend Sellersville Elementary as a kindergartner this year. I'm speaking as a mother and as a teacher. I'm also a 1998 Pennridge graduate, so to say that I've been Pennridge proud for a few decades may be an understatement. I would like to sincerely thank all the individuals who have been tirelessly working towards making decisions, providing lunches, communicating, collaborating, planning, cleaning, and scheduling education for our children this upcoming year. The care, concern, and attention to detail this is requiring is a daunting task, to say the least. The time, energy, and love is greatly appreciated. As an educator, I put my heart and soul into caring for and educating our children. Because some of the students that I work with are unable to advocate for themselves, and children rely on the adults in their lives to make the best decisions for them, I have made a promise to my daughter and to all of my students that I would always advocate and speak up for them when they are unable. The forefront of all my decisions in my profession and as a mother is what is in the best interest of the child. I can say without reservation that my dedicated colleagues consistently do the same. While opinions may differ and disagreements may be had, decisions are made for the children, period. Having a choice for my daughter's education in the fall is beyond appreciated. For our family, virtual is the option that we are most comfortable with. We do not have it completely figured out, but we're determined to make it work for our daughters and our family's health and safety. This decision is not made lightly, and my support, empathy, and respect goes to all families at this time who are in the midst of making very difficult decisions for their most precious children, especially when the only decision is to send their child back to school so that a paycheck may be earned. Because of this, it is up to us, the adults, to make the return to school as safe as humanly possible, to protect our children and all staff who provide care to our students. The CDC guidelines in our community are 6 feet apart with face masks. Any guidelines or expectations less than that in our public school is unacceptable. The current state of our country is a living curriculum. The very first step of teaching is modeling. What are we teaching our children if we do not uphold those guidelines that are provided to us by the experts and doctors in the fields of infectious diseases? And that we are not doing everything in our power in order to keep them safe. What message does that send to them? That their safety and health is not important? Because as a staff member being asked to return under these guidelines, that is how I feel. And trust me, I want to be back at school. To be frank, I think it's unacceptable. As a mother, a teacher, a colleague, a friend, and a community member, I am asking that the school board please reevaluate the safety plan in place in order to give our children and staff members the best possible chance of not spreading this virus. I appreciate you allowing us to speak, and thank you for all that you are doing.
Thank you. Are there other public comments?
Hey Murph, is the water cold?
Megan? Can you hear me? Sorry, I had a comment.
Yes, go ahead.
Question. Hi, Megan. I sent you an email. I wasn't because I couldn't get on earlier, but now I can. Is this the right time for my question?
Yes, I was going to read yours at the end, but since you're here, I'll let you take care of it.
Maybe I'll pop in. So my name is Dee Rankin. I am a retired teacher of Pennridge, just retired, but also from Hilltown Township and 28 years with Pennridge and 36 years overall. A couple questions from hearing everything tonight, and I understand that this is a very difficult decision for everybody. I would not want to be in your shoes, and I'm very thankful at this point that I don't have to make those decisions. But I've noticed from other districts nationally and locally have had problems with staffing trying to implement these different models. I was curious if Pennridge is also having issues trying to staff the different models that you have in place. That's my one question. I'm also curious what to do with what you plan on doing with classrooms and class sizes and what that's going to look like for these plans and staffing, because I can't imagine being an elementary school teacher and a middle school teacher that you are going to fit 30 kids in a classroom and be this 6 foot socially distanced. I don't see how that is going to be an option. I mean, I could see you spreading them out and having a lot of different classrooms with smaller sizes, maybe 15, but to have 30 kids in a classroom, if they choose to be in the hybrid model or the full in, I don't understand how you're going to do that. Like CB just announced today, is the district planning to hire additional staff then to accommodate having to be socially distanced? And it just seems to me, after listening to the financial presentation of the gentleman, you may have more funds and be more physically able to hire more teachers into these positions to separate these students enough so they can be 6 foot apart from one another. So they were my comments. But again, thank you, everybody. I'm, sorry we're in this position. I'm very thankful I don't have to make them, nor at this point come back, but appreciate being heard. So they're my concerns. Thank you.
Thank you. Are there other questions or comments?
Yeah, I'll go ahead.
Go ahead, Mr. Hogan.
Thanks. So Josh Hogan again, West Rock Hill Township. I just want to say a lot of folks on this call probably know me as I was referred to earlier as the conspiracy theorist. So I run a group of thousands of people called Reopen Bucks County. And one of our goals from the beginning has been to make sure that kids have an educational opportunity that includes in-class or in-person schooling. Spinoff group was also referenced, Pennsylvanians for Massless Education. And what I want to say as the leader of this group, or a de facto leader of these groups, is that I talked to Dr. Damsker like 2 or 3 months ago. We had a 4-hour conversation where, I was pressing him on things that our group wanted to happen, things that we were disagreeing with what was going on. And the reason I bring this up is to say that he made time for us because we're the people going around saying, if you're healthy, you shouldn't wear a mask. Restaurants should be able to decide how they do their business, et cetera, et cetera. And Dr. Damsker at the time, this was months ago, was very firm on his positions. And it is amazing in our hours of conversation about school children that his positions today on this call are exactly the same when public perception has turned around a complete 180 degrees. I just hope that might inspire a little bit of confidence in folks that, months ago, we were the ones pressing, and now you guys are the ones pressing, thinking that it's so wildly unsafe. I won't respond to the particular comments about, transmission from children to adults. Obviously that can happen, but the studies are just showing that is not the mechanism by which the virus spreads. And again, today, there is not one single case of a student infecting a teacher anywhere in the world, despite dozens of countries having gone back to school. I hope that people can come around to trust Dr. Damsker. I didn't quite a while back, but now, given that his tune has not changed, he's just stayed firm. He looks at the science and then sticks with that. I have a lot of faith in him, and I hope others will too.
Thank you. Are there other questions and comments?
Yes.
Could you please state your name and municipality?
I am Mila Keller, and I'm a Pennridge student.
Thank you.
In Hilltown Township.
Are there questions and comments?
Yes.
Could you please state your name and municipality?
I am Mila Keller, and I'm a
I think you're listening to the live stream. You'll need to mute that while you speak.
Okay, can you hear me now?
Yes.
Okay, so I'm going to be a senior this year, and I wish more than anything that my friends and peers could go back and just enjoy senior year. But at the end of the day, safety should be prioritized, and there's no way that you can ensure that students of any age will be responsible enough to take these procedures. And that's just a lot of responsibility for each and every one to handle, not just for themselves, but for everyone else. And if I'm at lunch and I get up and I talk to a friend without a mask on, the damage is already done, and I can't put a mask on and pretend like it didn't happen. I can't just wash my hands and forget that. And there is no possible way to control all of these students, and it's, I think, a bit absurd to expect that every student will be able to follow the rules to the T, because it's just not something that is that possible with that many students. And the main goal is safe learning. And just because parents and students will not be happy with all online does not mean that it cannot work. We will have to adapt and continue to do so. And wouldn't the school board and community of Pennridge rather want to look back on the beginning of this school year and be able to say that they took every precaution to keep Pennridge safe? And if students do contract the virus after returning, which will most likely happen, will you close the school? And if not, why? Because you can't just continue as if the outbreak did not affect anyone, because it has and will regardless of the precautions we take. And further precaution to isolate everyone who came in contact with those who are infected can all just be avoided by staying home. And there are many accurate theories about wearing masks and face shields and keeping a distance, but with these precautions, the numbers aren't decreasing, and going into school will not help that. And when the vaccine comes out, I believe it should be mandatory to get the vaccine before returning to school, not just for students, but for faculty and teachers. And it shouldn't matter where the student contracts the virus, whether that's in school or out of school. It matters that they can potentially spread it through school. So why don't we just stay home if that is the safest option?
I'd like to say something if I can, just to top off the night.
We only allow one comment per comment period, but there's also going to be 2 more comment periods in the next meeting. So if you want to speak at the first comment period for the special board meeting, you can.
When is that meeting?
As soon as public comment ends, public comment is going to start again in the next meeting.
Sorry.
My name is Beth Bengler, and I'm a teacher at Guth Elementary School. I do not live in the Pennridge School District, but I teach here and have for many, many years. And I have never been more Pennridge proud than I was listening to that young lady from our high school speak. And on behalf of all of her former teachers, thank you very much for speaking so clearly and so well, and thinking of your whole community, as well as yourself. It is not easy for any of us to talk about not coming back to school. We love school. I see school supplies. I have an actual problem. I need to be at school buying pens and paper and doing things for my kids. I miss them. I miss all of them. But on behalf of my own children, I would like it if everyone would take into account the fact that although the kids are very unlikely to perish in this situation, the rest of us are not. The reason our numbers are extremely low, as Dr. Damsker was trying to explain, is because we have shut down and we stayed home and we flattened the curve. And as soon as we started to see spikes, we stayed home again. And every time we've tried to reopen just a little bit, we've seen it again. And now we're watching it in other communities. So maybe Pennridge will not have to suffer the loss of one of its teachers or one of its lunch ladies or one of its principals or bus drivers before it's okay to shut us down again. Maybe we'll get to watch one of the Georgia teachers die instead, and then it'll be okay for Pennridge not to go back on the first day. I'm sorry if that sounds harsh, but that is the situation that my children are facing. And my parents, who I'm not going to be able to see anymore. Because unlike the nurses who signed up to be on the front line of medical care, I am a teacher. I am not a medical care provider, and I did not sign up to be on the front lines of the medical care profession. Neither did my coworkers. We are there always for you and your families. We love your children. To the bottom of our hearts and back again, we love your children. And we want what is best for them. And I do not believe that any of them ever having the emotional scarring of being in a classroom where one of their teachers dies and they know they may very well have been the kid to bring it in school. I don't ever want to see that happen to one of our kids. And I appreciate everything everyone has done this summer. Thank you so much for all the careful planning and for thinking about all of us and trying so hard to come up with something that will work. But please consider that this just might not be the right time.
Thank you. Are there other comments or questions from anyone else in the public?
I have a question, comment.
Okay, please state your name and municipality.
Chris Kaufman, Percy Borough. First, my first question is I'm curious as to how involved Dr. Damsker was with Centennial, Council Rock, Central Bucks in their decision to go virtual into November. It seems like he's very invested into keeping Pennridge open while the major districts in Bucks County have all decided to go virtual at least into November. And secondly, just to make the statement, my wife's a teacher. I have quite a few coworkers who their wives are teachers. I know how much that they put into taking care of their students and looking out for their students. And I think it's fairly easy for people to manipulate the data and to put their head in the sand and say that, X, Y, and Z is not an issue. However, the reality of the situation is, and I actually sent to Dr. Bolton today a news article referencing Israel and how they've had schools reopen and they've seen incredible spikes in transmission rates from students to teachers to the community, because it's got a exponential increase. 1 goes to 10, 10 goes to 100. So it's fairly easy for us to say, if something should happen, would that cause an issue in the community? But it's not an if, it's a when. And, in my situation, my 67-year-old grandmother, mother lives with my family. My son is severely asthmatic. If he would get something, he could transmit it to the house. There's kids in the neighborhood that could, that are in his class that could get it. They could bring it into the neighborhood. you could be looking at something catastrophic for the community on the manipulation of data and saying that this could happen, or, well, I don't see the data as being anti, going back to school. So I think that the decision should really be to err on the side of caution and say, there's issues across the country. We see that the schools in the area are shutting down. Maybe we should make the smart decision and say, we close down like the rest of them until November. We see what it looks like come into the bad flu season. And if it looks like things are starting to be on the uptick and we're doing pretty good, then we go back to school. If not, then we keep it on virtual. But to push it back now is a ridiculous thought process. I just don't understand how anybody could say that a worldwide pandemic is worth us risking our children's lives. So thank you.
Thank you. Are there other questions or comments?
Hi, yes, I have a comment. Can I speak?
Yes.
Okay, thank you. Hi, my name is Esther Hoffner. I live in Percy Borough as well, and I'm a teacher in another school district. I just had a comment I saw on the board agenda about live streaming, and I just want to make the comment that I really hope that the Pennridge School Board makes a consideration about live streaming before they spend any money on cameras or microphones the way that Central Bucks did. I do think that there are best practices that can be examined by the board regarding virtual learning, if that is what needs to happen because there is a spike in cases. And I hope that the board will consider best practices regarding virtual learning, before they just go ahead and say the best way to deliver instruction is, asking our Pennridge teachers to go into their classroom. If we go virtual and it's empty of students, that they will need to teach from their classroom, using virtual live streaming. There's a lot of other best practices out there regarding virtual learning. And I would hope that the board would consider those best practices before they just go forward and say, no, live streaming is the best way to do it. And so that's my comment. Thank you.
Thank you. Are there other questions or comments?
Yeah, I have one.
Please state your name and municipality.
Sorry, Jay Rowan, Hilltown. So I work with viruses as part of my job. And, so I have a healthy respect for them. And when this pandemic broke out, I was very cognizant and worried for the health of my family and kids, extended family. So that's what my original question was earlier in this meeting. I want to know what the data is. And I appreciate Dr. Damsker's knowledge. He started off his whole spiel with, exactly what the data is. None of us are medical doctors. He is. He works for the Board of Health, Department of Health for a reason. He's the only one here that's, in my mind, is qualified to have any position on, what we should do as a school district. I don't believe Dr. Damsker's position is politically motivated in any way. I absolutely trust him 110%. I was one of the people that wanted to err on the side of caution. I was one of the people that wanted to keep my 2 kids home until this whole thing blows over, until there's a vaccine available, blah, blah, blah. But because he said the prevalence is so low, the odds of, somebody even showing up to the school and having the virus at the same time is extremely low. And I think that's why Dr. Damsker has taken the position he has. I just want to make sure everybody knows that. Don't make the assumption that if you send your kids to school, that somebody there is going to get sick. That's just not the facts. The statistics actually are suggesting that, if we send the kids to school, there probably won't be anybody there that's infected. B, if we're doing social distancing and everyone's using PPE when appropriate, the risk of having an infection spread, even if one does show up haphazardly, is extremely low. So please take those into consideration. You know, it is a scary thing. I'm scared too. But, you know, I put my faith in data. I put my faith in professionals like Dr. Damsker. And he has, for me and my family, he has completely changed my mind tonight. And I appreciate the board for bringing him on and listening to sound scientific reason. Thank you.
Thank you.
Hello, I have a comment.
Please state your name and municipality.
My
Baba
name is
Booey.
Charlie Lanehart. I am a teacher at Pennridge High School.
Baba Booey.
I am not a resident. Is that?
I'm sorry, could you repeat yourself? Someone was chiming
That's
in.
fine. My name is Charlie Lanehart. I am a teacher at Pennridge High School since 1996. I am not a resident.
Yes, that's fine. You can still comment. Yes.
Yeah, I checked on the policy. I just wanted to speak about the data aspect. And I think one of the things Dr. Damsker was talking about was in Bucks County, the prevalence, or I'm sorry, within Pennridge School District, the prevalence. And this being a virus, you know, there aren't magical barriers around Pennridge School District. And so in looking at the state's early warning dashboard, Bucks County has an incidence rate of 36.3 per 100,000. And we have a positivity test rate of 3.4%, 3.4%. The new state guidelines that were put out today, that puts us directly in the moderate range. We either want to have 10 to less than 100 cases, we're sort of in the middle, and then, or our percent positivity rate, 5% to 10%. So we're below that, but we're directly in the moderate range. And so by the new state guidelines put out today, it says blended learning model or full remote learning. That's the data. We are at a prevalence rate in the county of 36.3 per 100,000. The data is clear that we, in my opinion, should be doing either a blended learning model or full remote learning. I have to admit, I'm personally fine with going hybrid. I'm ready to go. But I'm a high school teacher. Some of the elementary school teachers are being told they're going to have classrooms. Well, I don't know, whatever you decide. Let's say you decided to go. I know the districts are going to suggest blended for high school. But the idea of having 26 to 29 students in the classroom, looking at those numbers is just terrifying to me. So looking at the data as it exists, it seems pretty clear to me that the entire district should be either blended or full virtual. Thank you.
Thank you. Are there other questions or comments?
Yes, I'd like to make a comment, please. My name is Rebecca Kiner. I live in Bedminster Township, and I have 2 children who attend Bedminster Elementary. And I would just like to kind of piggyback on the person who just spoke prior, and that I do agree with your comments and the data and what it suggests. Although I am not a healthcare provider, I do work for Jefferson Health. And I work in HR, and I am privy to a lot of information as it relates to this virus and how it has affected our own staffing. And what I can say is I have been working remotely since March, and we will continue to work remotely until further notice, because the data that we are provided just does not show it is safe or that it is in our best interest to return back until we have a better handle on these numbers. I also speak as somebody who lost a family member to COVID in April. And this family member was in a long-term living facility. So yes, she was definitely at a higher risk and in a vulnerable population. But I can say to anybody out there who has not experienced a personal battle with COVID, I hope and wish that on nobody here, especially having somebody in a facility that you cannot be with your loved one as they are succumbing to this illness. So while many of you probably have not been personally affected, and I hope that that will stay, it is not something to take lightly. And while, yes, the children may not be at the greatest risk of this virus, and thank goodness they are not, they certainly can be a factor in the spread and the transmission of this virus. And we need to really take a hard look before we make, this decision to send them back, whether it be 2 days or 5 days. And for those reasons, I'm in full support of doing a full virtual, at least until we have better information and more promising numbers in the next couple of months.
Thank you. Are there any other questions or comments?
Mrs. Baines-Clemens, I have some that have been submitted via email.
Yes.
Okay. Some of the people were able to get on, so I obviously will not read theirs because they were able to make their public comment, but there were some who have not. So I'd like to read through those if I may. The first is from Sandy Kramer, who lives in Hilltown Township. She says the number in Bucks County show a significant decrease in numbers, with less than 1% of all cases impacting children. Countries that have reopened their schools have reported 0 incidents of students to teacher transmission, but we're going to keep thousands of kids out of school and maybe irreparably and negatively impact their education as well as their mental well-being. Perhaps for the first time in educational history, kids want to go to school. I think we should jump on that bandwagon and ride it through. Tricia Bornman, I don't know where she lives, I apologize. I find it alarming that the board was not prepared for the number of parents who would want to be part of listening and participating in such an important meeting. I feel as though it should have been rescheduled so everyone can hear and publicly comment. Or how about we hold it at the school? Since Pennridge seems prepared to open in just a few weeks, wouldn't you say it's a bit hypocritical to say the school board doesn't feel it is safe enough to meet in person? Despite outside political pressure and pressure from the loud anti-science contingencies in our community that might say otherwise, I hope that the school board chooses to focus on all virtual schooling for at the minimum of the first semester of the school year. For the safety of the school staff, both teachers and support staff, for the safety of the community at large, and for the safety of grandparents, parents, and children, it is the only responsible choice to make. If the teachers can begin to plan and focus on virtual schooling now, there is some hope that it will be done well and with success when school starts in September. Nicole Murray says, based on the new recommendations published by PDE today, it states that counties in the moderate level of community transmission, which Bucks County is, should consider blended or full remote learning. I'd like to hear if this changes the offering of option A, the full day, 5-day version. Julie Wallace lives in Hilltown and she has 3 children in Pennridge. I want to thank the board and other staff who have worked tirelessly to provide 3 options for parents and teachers to choose from. As we hear of fellow districts choosing to go virtual, I want to urge the board to stand strong in providing these options for our community and children. We have 1 hospitalization in the entire county for COVID, and cases have fallen dramatically off. The curve will never get flatter than this. Our kids need to be in school. We are the only country in the world even having this debate. Open our schools, our children need this. Thank you again for the endless hours you have put into this. Beth Wind said, I would like to know if the district has a plan for multiple COVID cases within one school and within the district as a whole. Is there a certain percentage of infection rate that would cause an individual school or the district to shut down? Suzanne Detweiler, who lives in Sellersville, I'm deeply disappointed that Pennridge arbitrarily took away the full-time return to high school students. Virtual school this past spring was an utter disaster of useless information. You are depriving our high school students of academic success and opportunity. If you gave our children and parents the option to return to the classroom full-time, then you really should have put more energy into figuring it out rather than just scrapping the program and throwing your hands in the air. I support our school, but I'm disappointed in your decision to remove an option that was never indicated as being at risk. Kristen Rendina from Percy Borough. Please follow the science and the new guidelines from Governor Wolf outlined today and begin the year virtually. There is no possible way that district teachers can safely and effectively teach our children using 3 different methods. We all want what's best for our community and our children. Asking our teachers to teach live, hybrid, and virtual is a 3-person job. There are no winners with that option, especially not our children. Let's evaluate the situation after the first marking period, and if the cases are low, potentially open up our schools for live instruction when it is safe to do so. Surrounding districts have made the wise decision to start virtual. Why should we sacrifice our children and adults working with them to say we were first? Gaps can be closed, lives cannot be brought back. Shelley Weigenberg, why did we have several emails to ask how we could like our children to return to school if we were only going to go against the popular vote? according to the response in school, was voted on in excess of 50%. I have a senior who is competing not only with people in the States, but all around the world for a place in college. My child has already lost a half year of education, and I and many others want our children back in school. The education that our child received at the end of the year was awful. He read PowerPoints and YouTube videos, not learning from his actual teachers. Please let the kids back in school. A nurse spoke earlier and she is 100% correct. I also work in healthcare and not one of us has contracted COVID. Sharon Burns says, open our schools, P8 Pennridge High School 5-day schedule. Tanya Vogel from Hilltown Township and a mother of multiple school children. As a mother, educator, and caregiver, I was appalled listening and watching the school board meeting last week at the comments being made by Dr. Bolton and the board members with regards to the 3 feet minimum guidance from the Bucks County Health Department. We are dealing with a potentially deadly virus that can not only make our children and staff sick, but can be brought home to parents, grandparents, and other loved ones. It is irresponsible to follow minimum guidance. Please do your best to keep our children, staff, families, and communities safe. Accepting 3 feet is the best you can do, given the physical square footage limitations in your buildings, isn't good enough. Will you be able to sleep at night if your decision sickens or kills a child, staff member, or their loved one? Please exercise your power to protect to the maximum extent you can. Please open our district with only hybrid or 100% virtual options. 5-day instruction at this time is irresponsible with the lives of those at stake. Our schools are schools, not daycares. We're the end-all be-all to the Band-Aid Society's shortcomings. Stacy Grant is a parent of a student who's going to be a 6th grader at Central this year. My concern is that if we do completely virtual learning, I don't have any resources that can help my daughter at home. My husband and I both work. I'm a dental hygienist and I'm in patients' mouths all day. I have not heard of a single case of COVID from any of my dental peers. I've been back to work as most of us have been since June 1st, 2020. I think if everyone does their part, social distancing where applicable and wearing face masks, we will be okay. My daughter learns best in a classroom setting, as well as other children that I know of, having a few learning disorders. I think keeping things as it is and maybe starting school after Labor Day would benefit everyone to work out whatever they need to. I know it's a difficult decision for all of you. I just wanted to give my point of view. Thank you for your time. And finally, Stephanie Thompson. As a parent and taxpayer within the Pennridge School District, I'm extremely disappointed in the attendance limitations associated with this evening's meeting. I'm only to watch a live feed of the Zoom meeting offered by a friend. I understand that Zoom has limitations. However, these limitations should have been investigated and explored well before today. Dr. Bolton, I appreciate your apology about the 300-person limit. However, it is not singularly your responsibility to facilitate public meetings of the school board. It is obvious that tonight's special meeting would have had higher interest from parents, teachers, and staff in the district. I believe that Board President Mr. William Krause should have investigated options to allow for a wider audience and broader participation. The school board leadership should have done better. I'm concerned about the latest guidance shared today by the Pennsylvania Department of Health and Education. Is the Pennridge School Board going to implement these new guidelines? Does the board respect the guidance of these Pennsylvania governmental agencies? Will these guidelines based on science inform the decision-making process of the board? Thank you. Thank you, Mrs. Banis-Clemens.
Thank you, Dr. Bolton. I also received a few emails, so I will read those from people who were not able to participate and try to respond as I go, and then go back to you for some responses on a few items so we can get responses to everything and then move on to the special board meeting. In response to the comment about not being able to hold more than 300 people, all I can do is apologize. I think we should have been more on top of that, and we apologize for not being on top of what those limitations were in Zoom. This is all new to us as well, and so we're trying to do our best, which is why I think we're trying to read public comments from email, which is a new thing that we've never done before. So we're trying to do our best, but it's something that obviously will be rectified in the future. And I know that we have people that have been trying to rectify it as this meeting has progressed. So it's not something that just kind of dropped off. And we've had presenters lined up. So that was part of moving forward. It is all recorded. If people have questions and comments in addition to what has been shared tonight, please feel free to email those in afterwards. I know the vote is ahead of time. I understand the concerns with that, and again, I apologize. Let me go through the other comments that I received. One is from Carrie Najarian. I'm sorry, I'm going to butcher these names more than if you all had got to say them yourselves. From Central Middle School, High School, student mom in Hilltown. Number one, regarding Dr. Damsker's suggestions, Doctor specified if everyone follows rules, how do you plan to guarantee this 100% at all levels? I would assume we'll need many more volunteers watching hallways in bathrooms and back of classrooms, but did not see that in the plans, so wanted to confirm. At the elementary level with the kids, will the kids sit still or follow instructions all the time, as many little ones have trouble listening to the teacher? I volunteer and see this often firsthand. Also, if little one sneezes in class, are they sneezing into their mask and wearing it the rest of the day, or touching it? Or taking off to sneeze in classroom? In middle school, how will you guarantee these rules 100% stay in place when kids go against rules with other things like phones, vaping, etc., and they just forget and pull mask down to say something because their friend can't understand them with the mask on? And same for high school. Also, doctor said ideally 6 feet apart, so can you confirm that a new option A in the middle schools would be 6 feet apart as the doctor recommended? Could the district utilize other empty industry buildings where workers are remote at this time? Or have those with IEPs in class and test virtual a virtual IQ, so those needing extra care get it, but the rest are on the same playing field? Teachers and staffing, what happens as teachers are out sick or out for other reasons, and including COVID or quarantining? How do we find the staffing needed for this? And if we choose virtual, are we guaranteed to get the same Pennridge teacher education as the other option kids? I would be more inclined to pick virtual, but afraid we'll not get Pennridge teacher with a set plan to stay in line with what in-class kids would be getting. Also, I know many who are on vacation or going still in red states, so perhaps virtual first 2 weeks could help any possibility of bringing back from another out-of-state location and into our schools. Just a thought. As far as getting guaranteed to get a Pennridge teacher, there isn't. If you're picking the virtual option, virtual is going to be running on the same schedule as everything else, so that if things change at a certain point, everyone could be brought right back into the regular classrooms. That's the idea behind the virtual. Are there other things you want to weigh the sneeze and the mask? What I actually don't even know if a kid sneezes into a mask, are they replacing the mask? Are they trying to wash out the mask? How does that work? I know you're not taking it off and sneezing it, because the whole point of wearing the mask is to contain the droplets, but I actually don't know what you do if you sneeze, after you sneeze into your mask. What is the next step? Do we have an answer to that?
So we'll continue to work on the safety protocols, and when we get down to that level of specificity, we'll have that plan in place. We're obviously working with the Department of Health as well as our own nurses in terms of those types of problems.
Okay. I will say, as far as the discussion earlier, if it is a shield, it's easy to wipe off, right? We had that part at least. Okay, the next, you got this one. Okay, this one is for Mike Groover. I'm sorry, Mindy Groover. It was signed Mindy Groover. Are there protocols in place to address heat safety in the elementary schools where there is no air conditioning available? Special consideration to how masks, shields, and September temperatures impact students differently than prior years. When classrooms are measured for desk spacing, are the measurements from edge to edge of the desks or in some other manner? Please elaborate. I believe the measurement is center of the desk to center of the desk is how the measurements are done. Dr. Bolton has as far as the heat index, Dr. Bolton looks at those temperatures, and when they're extreme enough, he does issue changes to whether or not there's going to be in-person schooling regularly. So that will continue in this situation if the heat index is too high. And he's shared that email. Is there, there's a description of that somewhere. It might be on the website. But that has been distributed and may be distributed again. I think usually right before we go back, that usually gets sent back A parent, Deb Yurchak, from Hilltown Township, wants to know if teachers who are concerned about this have been to Giant and Quakertown since the pandemic. Do they feel that the checkout people were at risk because people are still going to Giant? John Carey, I would like to thank the school board for inviting the public to tonight's meeting. Dr. Damsker gave us the best factual information tonight. He stated that there are 6 current cases of COVID in a district of 45,000 people. Thank you to Dr. Bolton and the board for their transparent communication to the community. Tonight's safety presentation was excellent. COVID is on the decline, and delaying our kids' happiness and spirit is a big mistake. I agree with many that it is time for the kids to get back to school. A question from Christy Scanlon. Did I hear correctly that the current cafeteria employees raise will be 2%? Brand new employees will be hired for the same amount of money that I will be making when I've been with the district for 8 years. Can you or Sean speak to that, since I believe that was an agenda item that will then be moving forward?
Yes, Megan.
We could have Ms. Giratano reach out to that specific employee in terms of their personal pay. The starting guide was set to $11. All the others received 2% raises. There will be no one who has been working here longer than a new employee that will be making less than them.
Thank you. Chuck Clifton, hi, I'm requesting you read my comment. Considering the reporting today that one super spreader student in Israel has infected 25 teachers, we should listen carefully to the comments of our educators tonight and make sure our best educators don't take leave, retire, or decide to teach in other districts. Our teachers are our second most important resource. I just have one more. I'm a parent of 2 Siler Elementary students in Hilltown. This is Janelle Kohler. I am reaching out in hopes of stopping Pennridge from pulling the rug out from under all of our families, like some other districts in our area have done. Did you read this? Okay. There are many reasons that I feel that kids should be back for in-person instruction. The biggest is kids need socialization. More youth are dying of suicide and overdose than COVID-19 during the pandemic. CDC Director Robert Redfield. Another reason that I don't feel like virtual education should be forced on all kids is excessive screen time is not good for the developing brains of children. There have been many studies that have proven this. Finally, since the pandemic, children have fallen behind academically. They have already lost 1/3 of a year. The benefits far outweigh the risk. Sending our kids back to school, children have shown little to no risk of significant symptoms with COVID. In Pennsylvania, there has been 0 deaths under the age 24. In fact, seasonal flu has a significantly higher risk in children, and we don't shut down schools for that. Bucks County numbers have been improving, so it makes little sense to shut our schools down now. In July, there were only 3 deaths in our entire county. Everyone should be allowed to make choices based on their family's comfort level. Based on the options given, families that are high risk have the option of doing full virtual instruction. For the rest of us that selected hybrid or full in-person instruction, please do not take these options away. If there are teachers that are high risk, there should be a way to accommodate them on a case-by-case scenario. Please do the right thing and allow parents to select what education is best for their own children. Okay, I just wanted to go through a few of the things. I took a few notes of things that were questions that people had. As far as cleaning your face shields before you bring them home, I'm sure that the students can wash them off before they leave, but they would be likely wearing them home. So I don't know that they'd want to bring them home in a bag unless they're just wearing a mask and then taking them off. But I guess that's an option that can be considered. I don't know the answer about staffing. And I think it's too soon to even know what that would be. As far as classrooms and sizes, it's full classes, but I know that they're trying to keep sizes as small as possible. And the full classes was a 4.5 average difference or different distance, and the 6 feet was for the hybrid, but requires masks for 4.5 feet. The district is going to do what they need to do as far as trying to cover with staffing. Dr. Damsker spoke to whether or not what would happen if things got bad. How involved was Dr. Damsker with the other districts? Dr. Damsker, as Dr. Bolton had pointed out, had regular meetings with all of the districts. All of the superintendents were involved in all of those regular meetings. He also attended many board meetings and shared the exact same information, but it's still up to each administration and board to make the decision. And that's based on, we have very different districts and communities. I actually spoke to a Pennsbury board member who we were discussing our surveys that came back, and the survey from Pennsbury from the community was completely opposite of what ours is. And so the interest in the community was completely different. And the numbers that they were dealing with were different than the numbers that we're dealing with. Live streaming, as far as best practices with virtual learning, I know that the administration has been working hard on best practices and has professional development, and is even looking to push the start date back 2 days to be able to address more professional development, to give teachers the time to be able to fully implement the things that they're being provided. As far as not being prepared, as far as the in-person meeting, the biggest reason not to hold this board meeting in public or in a public setting is not because of us. We have met in person, but if we would have held this meeting in public, all 300 people and more, obviously, but not even these 300 people could have come. We would have been outside of what is allowed for people to have 300 people in one setting. And a lot of the points being shared here tonight are suggesting that people have a fear of being in those large environments. We want to hear from people who have all of those different perspectives. And if we held it in person, a lot of those people may not have attended, and their voices wouldn't have been heard. So the benefit to holding it in this setting is to be able to hear everyone and make sure that all opinions are welcome and everyone's comfortable in a setting that they can share it. As far as taking away the option for full-time at the high school, I know that the administration was working really hard to try to offer all 3 options at all 3 levels, but the complication of trying to schedule at the middle school and the high school level with numbers and all of the different classes it just proved to be impossible. And so when they were going through that process, they realized that they could only do one or the other, along with the virtual option. And based on their analysis of those 2, it made the most sense, and their recommendation was to do the hybrid at the middle school level. The hybrid at the high school level and the full day in person at the middle school level. And that pretty much addresses all of the questions. As far as the comments that people made that are really kind of different people's perspectives, I'm not going to weigh in on those because I don't want to speak for other board members, but everyone has the opportunity to do that when that goes to a vote. So I'm going to close this meeting so that we can move on to the special board meeting where we're going to be voting on this evening, and then Mr. Kraus will take over. So I will adjourn finance.
Thank you, Mrs. Banis Clemens. I'm going to propose that we take a 2-minute, 5-minute bio break here. We've all been sitting here and listening to the comments from the community very carefully. It's an important night for all of us. So I would like to just ask for a 5-minute bio break, and we'll reconvene in 5 minutes. And everybody okay? Okay. See you in 5 minutes. It's up to you. You tell me. Okay, that's up to you. I'll call you for the committee report. All right, no problem. Bye.
Mr. Kraus, you are unmuted, just so you are aware.
Yep, I am
Okay.
sorry. My
Oh, no.
apologies to
No
those
big
on the
deal.
line.
Just wanted you
Yep,
to know.
just some logistics.
Mhm.
Okay, do we have everybody back? Are all board members back? I see Miss Banis Clemens. I see Mrs. Cullen. I see Mr. Gerhart. I see Dr. Thompson. I see Mr. Cormack. And I'm looking for Mr. Rice. Mr. Rice, are you here?
Mr. Rice is there. I see him.
Okay. And is Mrs. Dolan with us? Okay.
I'm here. I'm here.
Ah, okay. Oh, Frank's iPad. Okay, I should have remembered that. My apologies. Okay, I believe everybody is back. So I will call the meeting to order. And with that, we will do the pledge to the flag, if we don't mind. Mr. Rice has a nice flag in his background. We'll use that. So everybody bear with me as we do this. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you very much. Mrs. Chenoweth, would you call the roll, please?
Sure. Mrs. Banis Clemens,
Here.
Mr. Cormack,
Here.
Mrs. Cullen,
Here.
Mrs. Dolan,
Here.
Mr. Gerhart,
Here.
Mr. Kraus,
I am here.
Mr. Rice,
Here.
Dr. Thompson,
Here.
and Mrs. Walters.
That light's terrible. All right. Thank you very much. So we're going to move into public comment. And as a reminder, policy 903 still applies. We're going to limit comments to 3 minutes. That same rules as last time. So is there anybody that would like to make a public comment? I am hearing none. Is that?
Oh, quick, look around.
I would like
Hello?
to make a comment. Sorry.
Okay. Could we have your full name and municipality, please?
Sure. Denise Pollock, Sellersville Borough, parent of middle school 8th grader and a 11th grader.
Okay.
My comment is if we move to either hybrid or virtual for the high school or even the middle school at this point, if kids have IEPs that are not necessarily related to physical disabilities or autistic, how will that be handled if they don't learn by virtual or reading, as that directly affects their disabilities? And then my second question along that lines is, how are they going to work the tech school where some of these children, that kind of is their future? So it's not exactly just an elective, that's actually their future. Specifically with the 11th grader, who may be behind, obviously for disabilities, has 2 years to catch up, didn't learn anything in the spring, and may possibly not learn anything in the fall. So I'm just trying to see how the district plans on handling that.
Okay. Thank you. If you don't mind, we'll answer that at the end, if that's all right with you.
Sure.
I'll
Yeah,
ask
that's
Dr. Dalton if he will weigh in on that at the end, please.
Can I just say thank you to everyone and the board members? I know everyone is working hard. It's not ideal for anyone, and the teachers too. They've really done as much as they can with what they were given.
Okay. Thank you.
Mhm.
Other public comment?
Yes, if you don't mind. I just wanted to say thank you to all of you. I want to start off with that. I mean, you guys have been on this for like 5 hours right now.
Can I interrupt you for a second? I need your name and your municipality, please.
I'm so sorry. I'm Katie Rowland and I'm Sellersville.
Thank you, Katie.
So again, thank all of you. I mean, I'm getting just restless and tired being on it for 2.5 hours. So I think you guys are amazing, and everything that you guys have been doing to try and reopen, and to keep our children safe is nothing short of amazing. But again, I think I just want to make it known that I think it is detrimental that our kids are back in school. I think again, it should be left up to the families. If you're comfortable with your kids going to school, great. If you're not, great. I don't think anybody should be judging anybody or being upset with anybody. But I have, as much as I love the Sellersville teachers, and I had the best kindergarten teacher for my daughter, amazing. I just felt like she definitely regressed with her learning issues that she has from being virtual. And partly because I'm a working mom, my husband works, I work overnight. So I was a nurse at night and a teacher during the day. And so it was very stressful for us. And I'm not saying that's the reason it should be, but if we all do our part, I mean, my kid is amazing with wearing masks and washing her hands. And I think if we just continuously educate all of the children, I do think that it is capable to reopen. And I do think it's capable to safely educate our children, while making both or all parties happy. I think it's just at whoever's comfort level, whichever it is, wherever it lies, I think it should be left up to the families. And I think that, it really should be taken into significant consideration. Obviously you guys are, but that our kids need this. I mean, they're regressing in many ways and it's not going to get better. And this COVID's never going away. And we just need to learn to adapt to it. I mean, that's just how I feel. But thank you guys very much. I really appreciate it.
Okay. Thank you. Are there any other public comments?
I'd like to say something. Debbie Beal, Silverdale.
Thank you.
First up, thank you so much for everything you've done tonight and through the summer and last spring. I can't even try to wrap my head around it. I have 2 boys in high school. One will be a senior. One is a incoming freshman. Both are involved in extracurricular. I know from talking to both of them, one being football, one being band, these kids need to get back to school, and the sports have been practicing for the last month. And no one has come down with COVID. My kids have told me that the kids there that are involved in these, they wear their masks, they social distance, they do everything that is asked of them because they don't want it any more than we want them to get it. From what I've heard tonight from all of you and Dr. Dansker, you've done everything you are capable of to make it safe for our children and teachers and staff to return to school if they want to. I filled out that my kids wanted full return. They are disappointed they are doing hybrid, but they are accepting it and they will do it. So and if you're looking for a guarantee that you won't get sick or you won't die, it's not happening in this world. It's not happening in this lifetime. I lost my father-in-law in July, not due to COVID, just it was life. And not being in the hospital with him when he was going through that was the worst thing in the world. And there's no guarantee. I got through it. We will. But if parents and kids want to go back and you can make it work, they should have that choice. If parents and kids want to do virtual online and you can do it, we should do that. We should do all the options that you laid out for us and you provided. Thank you.
Thank you, Mrs. Beal. Any other public comment?
Hi, this is Andrea Tambori again from Hilltown Township in Souderton.
Yes.
I just wanted to touch on something I think one of the other parents had mentioned. Before I went to ask my children what their choices were, my daughter, who's going into 11th grade, came to me and said, "Mom, I want option A." I said, "Okay, well, that was my plan, so we're on the same page." The kids want to go back. It seems you've taken all the necessary precautions. It's had to be one of the toughest things you've probably all done. And no one seems to be taking into account, and this is what the other parents seem to reference, the suicides, the kids hungry at home. I know you've been offering, the food, but unless somebody can get the child to the school or someone to the school to get the food, there's hungry kids, abuse in the home. There's the socialization, there's a lot of things that are being lost, that also have to be considered, versus this virus. And like someone else also said, the flu, the elderly, COVID is a problem for the elderly primarily. The kids get the flu and they spread the flu, and we don't do any of this for the flu. And I don't mean to equate the two, they're not, exactly the same, but there's many factors that go into this, and the kids want to come back to school. I think we need to try to come back to school because, like others said, this isn't going away. And if it doesn't go away, how much longer are we going to wait? So again, thank you for all your efforts. If, I was hoping for A, I'm supposing we're settling for B. And lastly, I would just like to say the one thing I am confused about, which I'm sure you'll address at the end, is when we talk about going virtual, are these going to be live classes that these kids are going to have to log into? Because that's a real concern for me because of how I saw things go downhill in the spring. Or are these going to be like recorded kind of classes that the kids log into at any point? So that's my only question, and that's my comment, and thanks very much.
Thank you. Are there other public comments before we
I'd like to
continue
say
on?
something, please.
Okay. Yes,
Hi.
ma'am. Just your name and municipality, please.
My name is Mary Ann Busso, and my kids go to Guth Elementary, and we're in Percy Borough. Again, thank you all for all the hard work. This is a really difficult time. And I thank you for the choices that so far you've allowed the parents to chime in on. My main concern, because I've been listening to the meeting, I guess if the choices get to the point where the kids are able to go back to school, the teachers' comments have been a little bit concerning. So I know my kids have loved Guth. They love their teachers. Mr. Smith has been incredibly awesome. And I love the acronym that takes pride. And I just hope that as if we do head back into school, that the teachers would also consider, even though they might not totally agree with everything, just to be aware that the kids might pick up on any negative attitudes and things like that. So I don't know if you're giving the teachers choices or not, but I just kind of wanted to chime in on that because that would be disheartening if we had the choice and then we felt the discord. So I appreciate your time. Thank you.
Thank you. Is there any other public comment?
Bill, Mr. Chris? Oh, I'm sorry. I'll wait.
All
No
right.
worries.
Okay.
Thank you. My name is Abby Rose. I'm a rising senior at Pennridge High School, and I live in
Okay.
All right. I wanted to talk a little bit about the kids' perception of what's going on with COVID right now, and from our perspective, what it's like. I'd like to say that while a lot of us would like to return to school, it's important to keep in mind that not all kids are going to be cooperative. And also, a global pandemic is a huge, huge thing to be dealing with as a kid right now. This is probably the largest, global disaster that we've ever experienced of any magnitude, and it's very, very difficult to comprehend the weight of the situation and how much this is going to affect our lives in the future. It's also important to point out that cases in children haven't spiked because we were yanked out of school as soon as it became an issue. adults continued to go to work. We left school. We were at home. We were forced to be in quarantine the entire summer. Of course, there are exceptions. There are some kids who went to the beach, saw their friends, whatever. But I think it's really important to note that some of the information isn't exactly going to be applicable to a full school year where we're all back in school again. It's not going to be accurate because it'll be a completely different situation to what we've been dealing with this summer.
Thank you, Ms. Rose. Are there any other public comments? Okay.
I would like to make a comment.
Okay, your name and municipality, please, ma'am.
My name's Nicole Pisano Slam. I live in Hilltown Township. I have 2 daughters who attend Penn Central, and I'm a proud public educator. In the words of the late, great Kenny Rogers, you got to know when to hold them, know when to fold them. I believe the time is now to fold them and move to a full virtual school year start. While it was admirable to propose in-person options, because being in school is obviously the best place for kids to be, it is simply not the safest option at this time. And as other districts are experiencing, there are massive pragmatic staffing issues regarding to the trickle down of other districts going to virtual. The 3 proposals for each level in all their varying shapes and sizes is in no way feasible for teachers or administration to adequately staff and coordinate in the next 2.5 weeks until school is intended to start. Additionally, any in-school plan that is not capped for enrollment at the most of 50% is simply not a safe option, and any virtual option that does not ensure Pennridge teachers to be teaching compromises the quality of education with the outsourcing of courses to unknown staffing agencies and very little quality control. Neither of these specifications are delineated in any model. Based on today's guidance released from the state, it appears to be prohibitive to offer any in-person option at this time. Further, as the plans all stand now, there is no equitable option for the entire middle school population by only offering a fully in-person or fully virtual plan. With almost every district moving to a fully virtual model to begin the year, Pennridge is literally making our students and staff the guinea pigs for the entire Bucks and Montgomery County areas. Our students are our future, and our teachers are irreplaceable. You need to make a decision that is in the best interest of students and teachers tonight and give parents enough time to make plans. Delaying the inevitable move to virtual is simply upending lives even more so than they already are, and compromising the quality of instruction that could be provided safely by teachers who have time to prepare within the virtual model. The obligation of the board and the superintendent should be the safety and security of the students and staff at our schools. Having a political agenda is not what is meant for the school board. The extreme partisanship demonstrated on social media and elsewhere is in direct opposition to what we know to be true in science. For particular board members, this clearly has clouded their ability to reason through science and make safe decisions for students and staff, especially in regard to the interpretation of mask wearing. It is clear that the board needs to move to a vote for full virtual start for all students because it is the only safe and equitable decision to be made at this time. Thank you.
Thank you.
Yes, this is Lisa Hinkson, Central Middle. What I would like to say is let's err on the side of safety by doing the first semester virtual, and then let's reevaluate. It's the safety of our children what's most important, and the safety of our school employees. Thank you.
Thank you. Do we have any other public comment?
Hi, this is Karen Angelucci Schaefer. I live in Percy, and my children attend Bedminster Elementary.
Yes, ma'am.
I don't know if I can make a motion or if that's in parliamentary procedure rules for the vote.
No, ma'am, this is the solicitor. You cannot make a motion. You can make a comment.
Can I make a comment, then we move to vote? I think that a lot of the comments have been valid that that have been shared tonight, but I feel like after how many hours of regurgitating now the same comments over and over, I think it's time that we move to a vote.
Thank you. And thank you, Mr. Miller. Are there other public comments?
Bill, I have someone who, Mr. Kraus,
Yes.
someone who was not able to get in because of the limit.
Okay.
And so the question was posed if it would be at all possible at the high school level to allow for seniors to have the option to return to school for the 5 days. So I had mentioned that I would pass on that question.
Okay, Mrs. Cullen, do you know the individual's name and
Yeah,
municipality?
I was going to ask if you wanted that. So it was Shelley Weinberger, who I think, spoke earlier, and I'm pretty sure she's Percy.
Okay.
Mr.
Okay.
Kraus, I have
Yes.
two also, and they tried to get back in and they aren't successful. So if I could just read those two as well. Hello, members of the board. My name is Justin McCormick. I live in Sellersville and am an incoming junior at the high school. After listening to some of the meeting, I have a point I'd like to present. I feel that no one I've heard has given any attention being given to the negative mental health effects on students while doing virtual learning. To me, this is the most important thing, especially considering that the statistics show that there is a less than 1% chance of teenagers contracting COVID. Many kids have dealt with depression and anxiety over these past few months, and to send us back into isolation is extremely dangerous and unhealthy for us students. Please strongly consider how this harms our mental health and what is more important to you. Going back to school is what we all need desperately. Thank you for your consideration. And
I want to. He's going to mute me.
You're going to speak?
Yeah, I'm going to tell him.
Kelly, sorry about that. Kelly Ryan. I am in Percy Borough currently, formerly Sellersville, and before that West Rock Hill. My oldest is a senior and he has been at Pennridge since kindergarten, and my other is at South and has Crohn's disease. My question is, one thing that I would like to mention is that even though kids don't seem to be affected that much, we really do not know what the long-term ramifications are. They could have heart problems or other health problems as they get older. Does the district's general liability insurance going to cover any kid that gets infected at school and any long-term ramifications in health resulting from their illness? And I'm sorry, I have one more. Michelle Bolender from Bedminster. We need to end comment section and vote. Enough is enough. We've been listening to the same thing since 6:45. Thank you.
Thank you, Mrs. Baines Clemens. And I'm going to make the same suggestion. Unless there are other comments from the community members other than pro or con to the approval of the health and safety plan, I'd suggest that we move through this agenda so that we can get to the vote. So with that, I'm going to move on to the consent calendar.
If I could make a comment too.
Ma'am, I'm going to ask you to hold that till the end of the meeting. There will be one other comment session at the end of the meeting. Okay. So moving on to the
I'd like to make one comment prior to vote, if possible.
Ma'am, I've closed the comments for the now. We're moving on, and we will be opening up to at the end of the meeting for comments.
Okay, that's fine. Thank you.
Thank you. All right, moving on to the consent calendar. I make a motion to approve the consent calendar, items A and B.
I'll second that.
Seconded by Mr. Rice. Any questions or comments from board members? Hearing none, we'll do this the same way we've done it in the past. I will only entertain nays. So if I don't hear you vote in the negative, I'll assume that we've all voted in the affirmative. So with that, Are there anybody abstaining or voting negative to the motion? Okay, hearing none, motion passes 9-0. Moving on to the Activities Committee, Mrs. Walters.
Thank you, Mr. Kraus. There's a couple items, obviously, for approval tonight. First one is a motion to approve the Pennridge School District Health and Safety Plan for Fall Athletics and Activities.
I'll second that.
Okay. All right, motion made by Mrs. Walters, seconded by Mr. Rice. Questions or comments from board members?
Mr. Kraus, I have a couple clarifications I'd like to make.
Yes,
based on
Dr.
some of the
Bolton.
comments and the questions that happened. First of all, there has been mention of new guidelines that came out from the State Department of Education today. We were informed as early as most recently as Friday that no guidance and metrics would be coming out. And so of course, metrics landed this afternoon. So we were not aware of them. I have obviously read through them, but have not had any time to deeply look into those. And so I just want to remind the community that this health and safety plan and our decisions here tonight are living and breathing. We obviously need to plan and continue to move forward, but obviously we continue to monitor this situation hour by hour and day by day. And so we will respond to those guidelines, those recommendations. They are not requirements, but they are recommendations. And so those recommendations, as well as any change in the situation between now and the start of school. So I just want to remind everybody that this health and safety plan is something that can be continued to be considered. As we move forward, this is the next step in terms of considering the plan for us to be able to begin to open school. There was some conversation around IEP students as well as the different models that don't involve a full 5-day in. Obviously, the special ed department or pupil services department is in the process of actually evaluating all the students with IEPs and taking a look at their cases and reaching out to families to discuss individual situations. So obviously a student's needs come first in terms of that document. And so there are conversations between the pupil services department, case manager, and parents about students' fall placements. Anyone who has a student who has an IEP, if they have not been contacted, please reach out to your building principal and they can begin those conversations for you. There's been lots of conversation about what things were like in the spring. And we've said this over and over again, that what happened in the spring was a really, really good effort that we did not see coming. And so everyone obviously worked really, really hard, but we learned a lot about virtual and even hybrid education that will impact what we do in the fall. Our virtual and our hybrid models have a minimum of 3 days, and in some cases 4 days, of required synchronous live teaching. So whether that is hybrid and some are in the classroom and one is Monday synchronous, as well as virtual, where there are lessons that you must attend and they are at 10 o'clock or whatever the class period is, and so that there will be a schedule and there will be rhythm. There will also be worked in days where there are lessons you're learning, assignments that you're doing based on what you learned the day before, but there will be 3 or 4 live sessions in both of those. And our teachers and our support staff are working very hard in terms of how to best deliver those models. So I just wanted to clarify that, Mr. Kraus, and some of those questions came up and impact the vote we're about to take. Thank you.
Thank you, Dr. Bolton. I believe I have a second to this motion from Mr. Rice and Mrs. Chenoweth. Mrs. Chenoweth, I'd like to do this as a roll call vote, please.
Mr. Kraus, could I still make a comment?
Yes, you may.
Thank you. The CDC highlights the lower risk of COVID infection and transmission for children and points out that harms attributed to closed schools on the social, emotional, and behavioral health, economic well-being, and academic achievement of children in both the short and long term are well known and significant. The CDC goes on to say the lack of in-person educational options disproportionately harms low-income and minority children and those living with disabilities. These students are far less likely to have access to private instruction and care, and far more likely to rely on key school-supported resources like food programs, special education services, counseling, and after-school programs to meet basic developmental needs. We regularly have a PACE survey that is conducted in the high school. It's grades 6, 8, 10, and 12, and that data is related to some of these things. I just wanted to share some of the data points for some of the risk factors based on the survey that was conducted that with the students. 33.6% have used alcohol, 13.7% have used marijuana, 12.7% use alcohol have used it more than 30 days, 7.8% use marijuana more than 30 days, 13% are vaping more than 30 days, 23.4% have access to prescription drugs, 31% are gambling, 15% have said that they have had inappropriate sexual contact through technology. As far as students who said that they have been abused by another person in the last year, 17.8% have reported physical abuse, 24% threats, 69% emotional abuse, 10.6% other injury or abuse, 11.8% have reported that they have self-harmed, 27% have shared that they are suffering from depression, 13% seriously considered suicide, 9.7% planned to commit suicide, 7% said that they attempted to commit suicide, 1.2% needed medical treatment for attempting suicide. In the last year, 3.3% of students lived in a shelter, car, campground, etc., due to lack of money or housing. 3.4% lived away from parents because they were kicked out, ran away, or were abandoned. 7.3% of students have been worried about running out of food one or more times in the past year. 3.8% skipped at least one meal due to family finances. Only 10% of our students were not participating in some sort of hobby, activity, or sports. That means that 90% of our students were involved in extracurricular activities that are no longer being run in most cases. And again, that takes a toll on kids with isolation. The American Academy of Pediatrics, American Federation of Teachers, National Education Association, and the School Superintendents Association joined together in providing a statement advocating for a safe return of students, teachers, and staff. The statement said in part, educators and pediatricians share the goal of children returning safely to schools this fall. Our organizations are committed to doing everything we can so that all students have the opportunity to safely resume in-person learning. We recognize that children learn best when physically present in the classroom, but children get much more than academics at school. They also learn social and emotional skills at school, get healthy meals and exercise, mental health support, and other services that cannot be easily replicated online. Schools also play a critical role in addressing racial and social inequity. Our nation's response to COVID-19 has laid bare inequities and consequences for children that must be addressed. This pandemic is especially hard on families who rely on school lunches, have children with disabilities, or lack access to internet or healthcare. Returning to school is important for the healthy development and well-being of children, but we must pursue reopening in a way that is safe for all students, teachers, and staff. Science should drive decision-making on safely reopening schools. We must rely on the health experts in this area. When the CDC, the World Health Organization, the Pennsylvania Department of Health, the Bucks County Department of Health, the American Academy of Pediatrics are all advocating for a return to school with safety parameters in place, we have to rely on the health experts when providing options. That being said, I completely respect and sympathize with all perspectives and comfort levels and feel that parents know what's best for their children and should be the ones to weigh the pros and cons and determine what best meets the needs of their children and their families. I have 3 children in this district, and based on their needs, I am choosing different options for different kids. This is not a one-size-fits-all, and that goes for staff as well. I am hopeful the administration can work to pair as many staff members as possible with the options that best meet their needs, with extenuating circumstances and needs taking precedence. There's so much competing information out there, and nobody can give you a guarantee because we are in uncharted waters. No life is worth the risk, but not sending kids to school does not increase that risk. In fact, being in a controlled environment with safety parameters in place to mitigate the risk arguably provides a safer environment. What we are seeing is that these safety protocols are working. According to Dr. Damsker, who has been conducting the contact tracing, the COVID cases have been traced back to situations where people were not socially distancing or were not wearing masks. Many of us are parents in the district and care very much about the students and staff in this district and would never make a decision that would put people in harm's way. The administration has put a great deal of time and effort into this and analyzed every piece of literature they can get their hands on, as have we, balancing all concerns to provide options to best meet the needs of families and staff. My background is teaching at the elementary level, and I would never put anyone in an environment I myself would not feel comfortable in. That goes for all staff. I would be happy to spend time in any environment with any employee, teacher, custodian, bus driver, secretary, etc., to walk the walk. Send me an email and I'll be happy to join you. You know, I just want to stress the point that we would not be, you know, there may be different opinions on how things should progress, but please know that we are doing what we think is best, and nobody is making a decision feeling like they are in any way jeopardizing or not caring about the health and safety of students and staff. That is the primary focus. I grew up in Pennridge. I graduated from Pennridge. I have former teachers and friends who work for the district. I have kids and family members who attend in this district. Safety is the ultimate priority, and I respect where everybody is on this, and I hope that everyone can respect the different opinions and positions that people are taking and the decisions that they're making to try to keep their own family safe. Thank you.
Mrs. Chenoweth, before we go on to the vote, are there other board members who would like to make a comment?
Yes, please.
Mrs. Cullen.
Sorry, I know it's after 11 o'clock and I apologize. I thought that they were going to be two separate votes, but I do want to just say that, you know, for myself and my family, really the preference was to go back to school 5 days. That's what my children wanted. And they're high schoolers, so that option is not available to them. But I would like to point out that it makes me happy that 2/3 of our students have that available to them, that option. And I believe, Dr. Bolton, correct me if I'm wrong, but this plan that you've devised with your team, it's going to address or give 80% of our families what they had wanted. Is that correct?
That is correct. 80% of the families are receiving their first choice.
Okay, so I mean, and that makes me feel good that we're at least able to get, you know, 80% of the people into their first choice. And then I also wanted to make one other clarification, Dr. Bolton, that it is for everyone that has expressed what so many of us have said, that, you know, virtual can be a problem, not just for students who have learning difficulties, but with, you know, students in regular ed. Your desire and the reason why we're not putting a time frame on it is so that we have flexibility in switching back. Is that fair to say?
Sorry, Mrs. Cullen, you were breaking up there at the end.
My Wi-Fi. I was asking if it's fair to say that the reason why we haven't put a time frame on it is because we want to maintain flexibility to switch, because there are a lot of people who are concerned about that virtual learning for their students. So I just want that clarification.
Correct. We do not have a time frame on any of our options for both directions. Obviously, families, if they would like to request a change, should contact their building principals. And although we can't guarantee them, we obviously will work with any family to try to do what we can if there is space available. As well as the district needs to be ready to pivot if there's a change that is necessary from a district standpoint, and we are planning in that direction. So that if we need to either go all in or if we were to have to go full virtual, we will be ready to do that, and it will look very different than March did.
Okay, thank you. And again, in the interest of time, I will just say that this was a process that was long. I appreciate the effort that you, Dr. Bolton, and your team put forth to come up with this. It was not an easy task. I appreciate it, and I thank you.
Okay, other comments from board members? Mr. Rice.
I just want to thank everybody that was on this meeting, voiced their opinions. It's important. That's how dialogue happens. That's how compromise happens. That's how things get done. The administration, the student body, the students, the parents, everybody that was involved, the school board, everybody that's involved. I appreciate your time, your effort, the values that you brought, your concerns. They're all heard. They're all important. Dr. Bolton, I appreciate your efforts as well. Always data driven. Dr. Damsker, always data driven. Appreciate all of it. Thank you.
Okay. Any
I-
other board members would like to comment?
Lisa has a comment.
Yes.
So I'm not claiming to be an expert in anything. I'm a mom, I'm a community member. I'm married to an essential employee. Many people know me because I work at a local restaurant. I completely understand the fear that the school employees have of returning to work, because I had that fear, as well as my husband. And it was really hard the first couple weeks in March and April trying to adjust. But also as a former educator, I know that one of the things that teachers do best is they monitor and adjust, and we're constantly doing that as teachers. I view public school employees as essential employees for our students. Part of my concerns for that are the fact that I, as an individual, felt that I really struggled with virtual learning at the beginning of COVID, with my education degree, with a supportive spouse, with supportive grandparents close by. It was challenging. I also feel that I'm privileged to be in a position that if we were doing full-time virtual learning, that I could provide for my kids, and that my work schedule allows me to educate them at home. However, I'm in a position where I'm not making a decision based on my needs for myself and what's best for my family. I have to think about other people's children. Child abuse reporting is down. That's not because children aren't being abused. It's because they are not with mandated reporters such as teachers, coaches, guidance counselors, other professionals that notice things and needs in children and report them to the authorities. You talk to a local police officer, I've spoken with many of them, domestic violence is up. And I also have a friend that's an educator that during virtual learning had a student that was suicidal and had to intervene. These are real things that I think are occurring. I get the fear of our teachers feeling upset that perhaps a student or a staff member would contract COVID and possibly die. But I'm gonna, also stick up for people's mental health and the fact that I don't want anybody committing suicide. I don't want any parents that can't deal with the burden of a single mom that is an essential employee and has to go into work and now has to figure out how they have to educate their 3 children virtually. So I'm advocating for mental health, and I'm not trying to sound dramatic, but these are real things that people have expressed to me, and they're concerns that I think need to be addressed. And I think it's important to have our students have the option to return to school safely and to have precautions in place. And I trust our administration. I thank Dr. Bolton for working around the clock, nonstop this entire summer, as he should, but also, because he's an amazing leader and he has led the administration, and I trust that we will monitor and adjust and do well. So that is where I stand as an individual. And I appreciate everybody's concerns, and I'm always open to other perspectives, but I'm just weighing in with my perspective on this one tonight. Thanks.
Okay. Thank you, Mrs. Walters. Are there any other board members who would like to comment before I move on?
Sorry, sorry, I left out the part. I did want to speak to the social and emotional health of children. So that's all I want to say. I agree with that. Thank you.
Mrs. Cullen, it's almost 11:30. Are we ready to move on? Okay.
Mr.
Dr.
Kraus,
Bolton,
Mr. Kraus, real
I'd like
quickly.
to make a comment as well.
Okay, just real quickly, because I know it's late. I just wanted to thank the administration and Dr. Bolton's staff. Without them, we would not be in the position we're in today, looking at a plan looking at dealing with the community in a very positive way, which is real 100% supportive of their needs and their wishes. So, Dr. Bolton, you and your staff, congratulations. I think without you, we wouldn't be here today. So again, congratulations. And also to the community, just for reaching out and expressing your opinion. I think it was very beneficial to hear your thoughts and wishes on the health and safety plan. Thank you, Bill.
Thank you, Mr. Cormack. Mr. Gerhardt.
Yeah, thank you, Mr. Cross. I'll be pretty quick here. I know we want to get to a vote. I just did want to comment on, how, or my perspective, I guess, or, my view. I know schools, and there's no doubt schools provide, critical care and support for students' mental health. And I don't take lightly, and I understand the magnitude of kids not being in school and how that will affect them. I do think that I need to also consider the environment in which these students will be going back into. Kids are not going to have the same emotional support, and that is something that I'm sure everybody is aware of, and something that is going to have to be dealt with, and hopefully and met with to enhance the support that we do provide. I did want to talk about and just touch on the evidence that suggests that children don't spread the virus similarly as adults do. And I understand the different perspectives, and I think that's the point here. The different comments is we don't really know. And even if kids do get sick and transmit at lower rates, this is also a workplace for adults, and some of which have underlying health conditions. I fully feel, and I know the teachers do, everybody does, that there's no substitute for, in-person, in-classroom learning. And like I said, I believe our teachers feel that way. Virtual learning, I believe, will be better I fully believe that in the fall than it was in the spring, as everybody has mentioned. Is virtual the best option in a vacuum? No, I don't think that. But I think given the circumstances that we are under right now, it might be the best option. And the last thing I just wanted to touch on is, the death rates and everything like that are low. And I think the thought process behind that is that, oh, well, then it won't be my child or family member or friend, but it inevitably will be someone's. This is a difficult decision, and I don't ever pretend to suggest that I know what is 100% right or the best way to go. But I feel that our students, teachers, and staff and their safety is most important. And I think our students are best served when our teachers and staff are supported and encouraged and ultimately safe. I do take the needs and the comments from the community very seriously, and just kind of in line with that, I also feel that I need to strongly consider the teachers and the district employees as well. This is again a very tough decision, and like everybody else has said, I appreciate all the comments and work, and especially Dr. Bolton and everything on that. Thank you.
Okay, before we move forward, I believe we need
Bill.
to make a correction to the motion. Mrs. Dolan, I'm sorry. Yes, ma'am.
I just wanted to share. I know that I have been quiet. I just got my baby down, and I will make this brief as possible. I just wanted to share from my perspective. I'm truly on the fence about this, whether we should go back, whether we shouldn't. And I worked the entire pandemic until I had pregnant, and the entire pandemic until June 15th. I was at work until I had my baby on June 16th. My dad was in a bad accident, and he was fragile, and my mom worked. We all worked. We were really safe. We didn't bring anything home, thank God. But this past week, we've been safe. We've been staying home. I have an 8-week-old baby tomorrow, but somehow my children got cold. I got a cold. My husband got a cold. I don't know how. I haven't even been to Giant. And I was terrified. Like, my 8-week-old baby has a cold. And if they were my children, I would not be sending them back to school. So I wanted to be very honest. I did work the entire pandemic, but when I saw my kids sick, and even though it is just a cold, I was scared. And I don't want any other parent to think to have that. So I'm still not sure how I feel. And I should have probably rehearsed what I was saying a little more, but like I said, I just got my baby down, and I just wanted to share, what I went through. I wasn't scared working during the pandemic, even though I was pregnant. My OB said, wash your hands, wear your mask, you're going to be okay. So I feel like that's reassuring, but I also know how scared I was when my kids are sick. They're sick right now. So I don't think that there is any substitute for in-person education, but I also don't think the learning environment that they're going to be in is going to be the same. And I think that that is going to cause a lot of issues. I don't think that what we're anticipating isn't going to be normal. And until we're back to normal, not the new normal, we need to be cautious. You're not tired. Okay. But thank you. Thank you.
Okay. Thank you, Mrs. Dolan. So that being said, I believe I've heard from all board members at this point. Dr. Bolton, I believe we need to make a correction
Well,
to
you
the
didn't
motion.
hear from
You didn't
me.
hear from Sherry.
Up. There's Dr. Thompson. I'm sorry.
I'm here. I just want to thank everybody for their patience and their contributions and their perspectives. Thank you for sharing. And that's to all of our board members and also to the members of the public and administration and staff. Thank you.
Okay. Dr. Bolton, I think back to you.
Mr. Kraus, we need to make it clear that this health and safety plan covers more than just fall athletics and activities. Although it does cover those, it needs to read, approve the Pennridge School District Health and Safety Plan for the 2020-21 school year.
Okay. So the motion as amended, do I need to resecond that, Mr. Miller?
You do not. As everyone accepts it as a friendly amendment, then the record is clear on what you're voting on, and you can proceed to a vote.
Thank you very much. All right. So again, we're going to do this as a roll call vote. Mrs. Chenoweth?
Would you just reread the motion?
Okay.
Because we had so many comments.
So the motion will read, a motion to approve the Pennridge School District Health and Safety Plan for the 2020-2021 school year.
Thank you.
Okay. All right. Mrs. Chenoweth?
Okay. Mrs. Spanis Clemens?
Yes.
Mr. Cormack?
Mr. Cormack, your mic is muted.
It almost looks
Yes.
like oh,
Mrs. Cullen?
yes.
Mrs. Dolan?
Yes.
Mr. Gerhart?
No.
Mr. Kraus?
Yes.
Mr. Rice?
Yes.
Dr. Thompson?
Yes.
And Mrs. Walters?
Yes.
I meant nay.
Northwest of Maysville and just
Yeah.
outside of
I am so
Miss-
sorry. I am so sorry.
Mrs. Dolan?
Mrs. Dolan should be recorded in the negative, is my understanding.
Mrs. Dolan's, okay, you're negative. Okay. So motion passes 7-2.
Yes.
Okay. Thank you very much. Back to you, Mrs. Walters.
Okay, the next item for approval is a motion to approve the 2021 Pennridge School District calendar to reflect new start date for students as Wednesday, September 2nd.
I'll second.
Okay. Motion made by Mrs. Walters, second by Mrs. Cullen. Questions or comments from board members? Seeing none. Again, anybody abstaining or voting nay? Okay, hearing none. Motion passes 9-0. Back to you, Mrs. Walters.
Okay, the next motion is item C. It's a motion to approve first reading of new policy number 815.1, the use of live stream video on school property.
Okay.
I'll second that.
That was seconded by Miss Dr. Thompson.
Yes.
Okay. Seconded by Dr. Thompson. Questions or comments from board members? Seeing none. Anybody abstaining or voting negative? Seeing none, motion passes 9-0. Back to you, Mrs. Walters.
Okay, the next item is a motion to approve model school board resolution, school code 520.1.
Okay, and Mr. Miller, do we need to read this or?
Is there a title? Mrs. Walters, I don't have the agenda in front of me.
It's the model school board resolution.
Yeah.
Right.
So,
No, if it's been circulated to the board, that's acceptable.
okay. So
Second
I'll
that.
seconded by Mr. Rice. Questions or comments from board members?
Mr. Kraus, I just want to clarify for people who may not have been at the committee meeting or listened to the committee meeting that this resolution is just something that must be done because the current school code does not provide students to attend school unless they are full in or full out. So any students who were to attend via hybrid would not get credit for their school year unless we pass this model resolution. And so this is just something that all school districts are doing. It doesn't change anything to the plan. It allows us the same options that we'd have regardless, but it does allow us to certify that those students did attend school for the correct number of days and hours.
Thank you for that clarification, Dr. Bolton. Okay, so we have a second on the table. Questions or comments from board members? Seeing none. Anybody abstaining or voting in the negative? Seeing none, motion passes 9-0. Back to you, Mrs. Walters.
Okay, the next activities committee meeting is scheduled for Tuesday, September 8th.
Thank you very much. That brings us to old business. Any board members have old business? Okay, seeing none, that brings us to new business. Any board members with new business?
I'm not sure if it was spoken about this evening, but did we touch on the schedule for the technical school students and the transportation and that they'll be there 5 days in person?
Dr. Bolton, did you hear that?
I did. Mrs. Dolan, the tech school has not finalized their plan. And so I would not like to speak to their plan, although I know they're talking about various options just like we are. But Pennridge has committed to, regardless of the student's plan at Pennridge or the plan at tech school, that Pennridge will be providing transportation both to and from, whether that be from the high school or a student's home, based on the tech school schedule as well. So I expect to hear something this week from the tech school to finalize that plan, and then I know they're reaching out to those families.
Yeah, and Dr. Bolton, can I just add that in the last meeting that we had at the tech school, the proposal that they brought forward was for a 5-day full return to the tech school. So that was basically what their plan was, to bring back to the board for a vote at the next meeting, unless that changes with different guidelines and parameters. But that was kind of where they were at the last meeting.
Okay. And that brings us to comments or questions from guests. So I'll open it up for public comment. Is there anyone who would like to make a public comment at this time?
So does
Can we have your name and municipality one more time, please?
okay, Katie Rowland, Sellersville. Sorry.
That's okay.
So with those votes, was the 9-2 vote, meaning that the plan that was put in place with the 3 options, like for elementary, middle school, and all those plans, are they in place now? Like school will be starting September 2nd?
Dr. Bolton, do you want to take that directly or you want to wait for all the comments?
No, so yes, that vote does approve the plans for the start of school, which is currently the options that were sent out last week, as well as the health and safety plan, as well as the change of the school calendar that would make it September 2nd. So we will continue to monitor, and if we need to make any adjustments, we will. But yes, that is what the purpose of that vote was.
So as of right now, whatever 80% of the families, they're their first choice, that's what their kids will be doing starting the school year.
Correct.
Perfect. Thank you guys all very much.
Okay, thank you for your comment. Any other public comment?
I have some questions,
Oh, go ahead.
please.
Hold on. And your name and municipality, ma'am? And you need to mute your, yeah. Okay. Hello? Okay, any other public comment?
I'm sorry. Yeah, I do.
All right.
My
name
name's
and
Jason Rowan. Sorry, Jason Rowan. I'm in Hilltown.
Thank you, sir.
Yeah, sure. I've heard some other people mention concerns with less fortunate citizens of our school district that may not have, you know, as much privilege as others to or access to teachers or resources. I was wondering if there's any way that if the board has ever considered maybe recruiting tutors to you know, meet with these people. I mean, for me, that's something that I would certainly sign up for. I'm a scientist, so I'm.
Mrs. Miller, could we mute anyone who's not participating, please?
Yeah. So anyway, it's just something to consider. Maybe getting tutors involved, and maybe we could reach out and help those less fortunate. That's all.
Thank you for your comment. We're going to kind of hold that for the time being as we progress through. Any other public comments?
I have some questions.
Hold on. Your name and the municipality, ma'am?
Beth Feast from Sellersville.
Okay.
Just a clarification, start of school is going to be on September 2nd. Is that correct?
Yes.
Thank you very much.
You're welcome. Any other questions from the public?
I
Yes,
have
ma'am.
some questions, please.
Okay. Name and municipality, please.
This is Nicole Pisano Slam from Hilltown Township.
Thank you.
I am asking a number of questions. Number one, has an administrative recommendation ever been made to the board in regard to what they think is the most feasible plan to address staffing and safety concerns like other district superintendents have made? That's one of my questions. I also would like to ask the board member who offered to walk the walk, would she cover cafeteria duty at the middle school every day with the potential of at least 80% of students returning to the building every day to eat lunch there? And that's pretty much where my questions lie.
Okay. Thank you. We're going to hold that too as well. We'll circle back to you. Any other public comments at this time?
I just have one.
Okay. Name and municipality, please.
Denise Pollock, Sellersville,
Yes, ma'am.
Borough. And my question is more for the high school. I know that tech school hasn't come to a decision yet, but if we haven't heard, what's a date that we could kind of circle back with the tech and also our children's, mine has an IEP. We haven't heard from the high school IEP person, support person either. When should I start reaching out? Because I know they have a ton of things to do, but I also need to make plans myself.
Okay. Thank you for that. I'll let Dr. Bolton handle the IEP question because I think he touched on that a little bit earlier.
Yeah, he just didn't give a date, and I just want to make sure I'm following up.
Okay. All right. Okay. Any other public comment? Because we have a few people we need to circle back to.
Yep.
Okay.
Here.
All right. Mr. Hogan, are you?
Yep. Josh Hogan, West Rock Hill. I just want to address what Dr. Bolton referenced in another community member's comment about the state recommendations that came out today. So those recommendations are built on cases, basically case prevalence in the community, as well as positivity of tests. Clearly, that's the only thing the governor can hang his hat on to keep this charade going, because nobody's sick anymore. Dr. Damsker referenced this, that hospitals are clearing out. Our death and hospitalizations have been flatlined for a long time, just like every other state in our situation, including Illinois, Delaware, Maryland, DC, Rhode Island, Connecticut, you can name all of them. None of them have people getting sick anymore. So with that being strictly focused on cases, the reason I wanted to speak to that is, again, just to throw a shout out to Dr. Damsker on the distinction between cases and sickness. Here in Bucks County, we have one person in the hospital right now with COVID. Compare that to 47 people right next door in Montgomery County, or like 30 in all of the other collar counties that are around Philadelphia. We have one. He has clearly done an amazing job and knows what he's doing, and he would not want to throw that success away by opening up schools and putting everybody at risk just to throw away all of his hard work. So that was the only thing I wanted to say.
Okay, thank you for that. I'd like to see if we could circle back, Dr. Bolton, to a few of the questions that were asked, if that's okay.
Certainly, Mr. Kraus. From an IEP standpoint, Ms. Pollock, as I said, please reach out to the high school administration, either Dr. Cashman, the principal, or your house principal, and they'll be able to start that process, and you can do that tomorrow. Tech school, Ms. Banis-Clemens, do you know when the next tech school meeting is scheduled?
It's 8:20.
Okay, so I'm meeting with the tech school administrator tomorrow morning. And so we're going to obviously have a conversation around his communication. I would suggest if you don't hear anything this week about planning process, next week would be appropriate to reach out to them. And to Dr. Pisano's slam, the administration has worked on the recommendation that was approved this evening. And so from an administrative recommendation standpoint, the administration obviously has worked with the school board. And so those recommendations do come through the administration.
Thank you,
Mr.
Dr.
Kraus,
Bolton, for following up.
Mr. Kraus, can I just say that
Yes,
I would be happy to shadow in the cafeteria with that employee if she wants to send me an email.
Okay. Okay, so I'd like to move to adjourn this evening, but I have a couple of announcements first. An executive session was held on July 22nd to discuss personnel matter, and on August 3rd to discuss a safety matter. The next regular school board meeting is scheduled for Monday, August 24th at 7 p.m. And with that, I'll make a motion to adjourn.
I'll second it.
Seconded by Mr. Rice. Board members?
Aye.
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 All in favor?
Aye.
All right.
Good night. Thank you.
All right.
Thank
Good
you,
night, everyone.
everybody.
Thank you. Thank you
Thank
to
you.
the community and those that hung in. I appreciate
Appreciate
it.
everybody.
Yep. It's very much needed. Thank you.
Thank you.